Fakultas
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Greetings everyone. Good morning, afternoon or evening, wherever you may be.
We cordially welcome you to the second International Conference on Health Science held by the Faculty of Health Science, UIN Syarif Hidayatullah, Jakarta, 24th until 25th August 2022.
My name is Dinda Febriana.
And my name is Irzan Salampesi.
We are the students of Faculty of Health Sciences, UIN Syarif Hidayatullah, Jakarta, who will be your master of ceremony for the next 2 days.
First and foremost, let us give our praise to Allah Subhanahu wa Ta'ala for His blessings, and because of Him who has given us guidance, health, and mercy to be able to attend this special event.
Let's not forget to pray our blessings or salawat to Prophet Muhammad sallallahu alaihi wasallam, who has brought us out from the darkness into the light. Before we start the panel session, we would like to read the rules and regulations that we hope all participants will adhere to. All participants should silence all the mobile phone. The participant will be muted for voice hearing during the presentations, but will be able to provide questions via the chat mechanism on the online meeting software. The participant will be able to create a discussion and ask questions during a discussion period as mentioned in the schedule. You may not ask personal questions or non-subject related questions during the Please show up on time. You may not disrupt the presentation by logging late, but you may miss important information.
Make sure your video background is proper without any distractions. Ask questions consciously. Webinars are focused, so be sure your questions are too. Avoid wasting time in lengthy introduction and don't self-promote or spend a lot of time sharing your opinion before asking a question. If you have a comment, you are only allowed to comment if there is an important issue to discuss. And last, please refrain from making conversation in the chat boxes that are not pertaining to the discussion of the topic. The next agenda is Tilawatil Quran, or the reading of a passage from the Al-Quran, which will be read by Miss Ma'aratus. To the Honorable Miss Ma'aratus, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. وَلْتَكُنْ مِنْكُمْ أُمَّةٌ يَدْعُونَ إِلَى الْخَيْرِ وَيَأْمُرُونَ بِالْمَعْرُوفِ وَيَنْهَوْنَ عَنِ الْمُنكَرِ وَأُولَئِكَ هُمُ المفلحون. ولا تكونوا كالذين تفرقوا واختلفوا من بعد ما جاءهم البينات وأولئك لهم عذاب عظيم. وأولئك لهم عذاب عظيم. صدق الله العظيم. ثم السلام عليكم ورحمة الله وبركاته.
Thank you for the beautiful recitation, Miss Ma'aratus.
Now is the singing of Indonesia National Anthem, Indonesia Raya. Ladies and gentlemen, please rise up. Ladies and gentlemen, you may be seated.
Next is singing hymn Uin and Mars Ficus. Ladies and gentlemen, you may be seated.
Langkah berpijak menuju angkasa, menggapai gemilang bintang. Temukan harapan di setiap langkah, mencari satu impian. Apapun yang akan terjadi nanti, yakinlah semua kawan, bersama FoHS maju di bawah panji Islam, selalu berjuang. Langkah bijak menuju angkasa, sampai gemilang bintang. Temukan harapan di setiap langkah, mencari satu impian. Apapun yang akan terjadi nanti, yakinlah semua kawan, bersama FoHS maju di bawah panji Islam, selalu berjuang. Bersama FoHS, bersama FoHS.
We would now like to invite Mr. Yardi, PhD, to give his report on the behalf of the conference committee. To the Honorable Mr. Yardi, PhD.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin wa bihi nasta'inu ala umuri dunya waddin. Wassalatu wassalamu ala asrafil anbiya'i wal mursalin wa ala alihi wa sahbihi Rasulillah. The Honorable Director of UIN Syarif Hidayatullah Jakarta, Professor Dr. Hajah Amani Lubis, Master of Art, the Dean of the Faculty of Health Sciences, Dr. Pharmacist Zilhadia, Master of Science, our keynote speaker from National Research and Innovation Agency, Professor Dr. Veterinarian Niluh Putu Indi Darmayanti, Master of Science, our invited speakers from overseas, Professor Dr. Hitoshi Oshitani, Assistant Professor Dr. Ponce Julamet Aren, Professor Dr. Aisyah Adam, Associate Professor Dr. Nardek Dorasi, Professor Dr. Omar Hassan Kosali, the Honorable our invited speaker from UIN Syarif Hidayatullah Jakarta, Dr. Minsar Nawati, Master of Health, Nuraini Agustin, PhD, Putri Amelia, PhD, all Vice Dean, all Head of Study Program and Secretary, Head of Administration of Faculty of Health Science, lecturers, researchers, and presenters, all conference participants. First, let's ask thanks a lot to Allah subhanahu wa ta'ala for His blessing that we can gather here in this good session. Let's also praise and send greeting to our illuminated great Prophet Muhammad sallallahu alaihi wasallam. Dear honorable speakers and distinguished participants, ladies and gentlemen, on behalf of organizing committee, it's a pleasure to welcome all of you to two-day hybrid conference, the second international conference on health science 2022. The main theme in this second conference is Global Health Partnership on Addressing Socio-Religious Determinants for Sustainable and Equitable Health Development. It describes how important the partnership among us to develop the better health for the community, for now and for the future. Ladies and gentlemen, this conference will provide an opportunity for multidisciplinary participants, academics, researchers, and students in the field of pharmacy, nursing, public health, and other related health sciences to share their knowledge, experience, and achievements of the latest research. As many as 80 research topics will be present in these 2 days in the form of oral as well as poster presentations. This topic comes from pharmacy, public health, and nursing. The organizing committee gratefully acknowledges the Director of UIN Syarif Hidayatullah Jakarta and the Dean of Faculty of Health Sciences in bringing forth this conference. We also would like to thank to all the chief editor of the journal partners and the team. We hope that all ICHS 2022 manuscripts can meet the requirements and be published. Furthermore, I would like to express my deep appreciation to all members of the organizing committee for the good teamwork and great effort in making the conference successful. To all of you, thank you for being here. Welcome and enjoy the conference. Assalamualaikum warahmatullahi wabarakatuh.
Thank you for your report, Mr. Yardi, PhD.
Next, we would like to invite the Dean of the Faculty of Health Science, UIN Syarif Hidayatullah Jakarta, Dr. Zilhadia, Master of Science, to give her speech. To the Honorable Dr. Zilhadia, the time is yours.
Bismillahirrahmanirrahim. Honorable Rector Syarif Hidayatullah State Islamic University Jakarta, Professor Dr. Hajah Amani Lubis. I'm so sorry, repeat again. Honorable Rector Syarif Hidayatullah State Islamic University Jakarta, Professor Dr. Hajah Amani Lubis. Honorable all speakers, Honorable Vice Rector, Vice Dean, Head of Study Program, Lecturer, Committee, Honorable our guests, participants, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. All the praises and thanks be to Allah. The Faculty of Health Sciences is able to conduct the International Conference on Health Sciences for the second time, entitled Global Health Partnership on Addressing Socio-Religious Determinants for Sustainable and Equitable Health Development. Salawat and salam always be upon our Prophet Muhammad, who has guided us with his sunnah, especially on the significance of learning. Ladies and gentlemen, after being established in 2018, the Faculty of Health Sciences continues making various efforts to become a reputable faculty at the national and international level. One of them is by holding an international conference. The Faculty of Health Sciences must actively participate in building the whole of Indonesia and the world. Cooperation with many parties is essential to build post-pandemic health. To build global health requires collaboration with various elements of the nation, such as government and non-government organizations, companies, universities, communities, and etc. Therefore, the selected issue is global health partnership in addressing socio-religious determinants for sustainable and equitable health development. Ladies and gentlemen, this international conference is intended to increase the number of international publications among the academicians, to share ideas about health topics, and to explore collaboration opportunities. Hopefully, the speakers, participants, other audience will enjoy the conference and benefit from it. On behalf of the Faculty of Health Sciences, I would like to show our gratitude to all speakers, namely Professor Dr. Niluh Putu Indi Darmayanti from BRIN Indonesia, Professor Dr. Hitoshi Oshitani from Tohoku University, Japan, Professor Dr. Ponchai Julimate from Burapa University, Thailand, Professor Dr. Aisyah Adam from University Technology Mara, Malaysia, Professor Dr. Nurdeng Duraisah from University Islam Sultan Syarif Ali Brunei Darussalam, Professor Dr. Omar Hassan Kosali, Secretary General of International Institute of Islamic Thought, Dr. Minsar Nawati, Ibu Eni Nuraini PhD, dan Ibu Putri Amelia PhD from State Islamic University Jakarta. In particular, I would like to send my deepest thanks to the keynote speaker, the reviewers, the event chairman, the event committees, the head of department of the Faculty of Health Sciences, participants, audiences, and all parties that I cannot mention for the extended support on this conference. Thank you very much for your kind attention. Assalamualaikum warahmatullahi wabarakatuh.
Thank you for your speech, Dr. Zilhadia.
Ladies and gentlemen, now we would like to invite Professor Dr. Hajah Amani Lubis, Master of Art, Director of UIN Syarif Hidayatullah Jakarta, to give her speech and officially open our conference. To the Honorable Professor Dr. Hajah Amani Lubis, Master of Art, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah wassalatu wassalamu ala rasulillah amma ba'd. Honorable Dean of Faculty of Health Sciences, Dr. Zilhadia, and all of the Vice Deans, heads of study program, and all of the academic staff in the faculty of Health Sciences. I would like to greet also the keynote speaker of this conference from the National Research and Innovation Agency of Indonesia, Professor Dr. Niluh Putu Indi Darmayanti, and also invited speakers from Japan, Thailand, Malaysia, Brunei Darussalam, and also from Triple IT, all of the distinguished speakers and also researchers of the conference. First of all, I would like to welcome you in this very precious event, the second international conference on on health sciences. It's not written here. Okay, so this is very important and very timely, especially the theme of the conference is Global Health Partnership on Addressing Socio-Religious Determinants for Sustainable and Equitable Health Development. This is very important theme to be discussed by the experts, by the researchers and lecturers, professors of the universities. So I'd like to thank all of the participants and speakers for all of this effort to make this conference successful. Alhamdulillah. Yeah, ladies and gentlemen, the COVID-19 pandemic has exposed the long-standing structural drivers of health inequities, such as precarious and adverse working conditions, growing economic disparities, and anti-democratic political processes and institutions. These important determinants of health have interlinked with class, ethnicity, gender, education level, and other factors during the COVID-19 to exacerbate existing social vulnerabilities in society. Therefore, the social determinants of health agenda has been influential in highlighting and reducing inequities. One of approaches called Global Health Partnership are widely promoted as a mechanism for strengthening health systems and achieving the Sustainable Development Goals. Global Health Partnership, partnerships with plural, are situated in complex political and economic relationships and involve partners with different needs and interests, such as government agencies, non-governmental organizations, corporations, universities, professional associations, and philanthropic organizations and communities. This concept of GHPS or Global Health Partnerships is expected to be an answer for creating an equal or the equity of health and prosperity among countries. As experts argue, that specific practices could enhance the global health partnerships partnerships' contributions to equity, both in their processes and the outcomes. Enhancing partnering practices to focus on inclusion, responsiveness, and recognition of these global health partnerships are situated in a broader and inequitable political economy is considered a need to be done immediately, inshallah. Yeah. Finally, I would like to thank the organizers, the committee organizers, especially the academic committee who decide the researchers and also decide the participants of this international conference. And as I'm informed that through the virtual media, we also can disseminate this the findings of the conference widely. So the second international conference on health sciences, held by the Faculty of Health Sciences of the Syarif Hidayatullah State Islamic University, will be successful, inshallah. And by saying Bismillahirrahmanirrahim and seeking Rida Allah, or the satisfaction of God, so I open this the second international conference on health sciences. I open it officially. Thank you. Yeah, may Allah bless all of us and all of our efforts to make the conference successful and also fruitful. I hope all of the participants and researchers, the attendees, will have a very good insight and a fruitful discussion, inshallah. I saw also outside this ballroom, there are some other rooms for parallel sessions, so it's very encouraging to deliver our findings of the research. Thank you very much, and I expect all of the findings will be disseminated in journals, academic journals, scientific journals, so that will give the researchers, the lecturers, opportunities to be developed in their academic career and also works. Thank you very much, and I hope you have a very nice time and discussion in this conference. And I would like I would like to thank Professor Dr. Hitoshi Oshitani from Japan and Professor Dr. Pornchai Julamet, Professor Dr. Aisyah Adam from Malaysia, and also Professor Dr. Nurdeng Duraiseh from Brunei Darussalam, and Professor Dr. Omar Hassan Kasole from Triple IT. We usually meet in other virtual meetings, with lectures of Triple IT. But this time we are in this conference. Thank you very much to all young researchers and young graduates, PhD graduates of the faculty. Yeah, and I hope the faculty also will develop from the side of the human resources, inshallah. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much for your speech, Professor Dr. Hajah Amani Lubis, Master of Art. May this event run smoothly from beginning until the end.
Last on our opening agenda, we would like to invite Mr. Ismail to recite the prayer. To the Honorable Mr. Ismail, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Astaghfirullahaladzim, astaghfirullahaladzim, astaghfirullahaladzim. Alhamdulillahi rabbil alamin, hamdan syakirin, hamdan na'imin, hamdan yu'afi ni'amahu wa yukafi'u mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karim wa azimi sultanik. Allahumma salli ala sayyidina Muhammad wa ala ali sayyidina Muhammad. اللهم اغفر للمسلمين والمسلمات والمؤمنين والمؤمنات الأحياء منهم والأموات إنك سميع قريب مجيب دعوات ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين ربنا هب لنا من أزواجنا وذريتنا قرة أعين واجعلنا للمتقين إماما رب اغفر لي ولوالدي وارحمهما كما ربياني صغيرا ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار بفضلك سبحان ربك رب العزة عما يصفون والسلام على المرسلين والحمد لله رب العالمين والسلام عليكم ورحمة الله وبركاته.
Thank you, Mr. Ismail.
Ladies and gentlemen, now we would like to invite Professor Dr. Veterinarian Niluh Putu Indi Darmayanti, Master of Science.
Ladies and gentlemen, before we continue to our next session, we would like to ask all participants to please take a picture with the Rector of UIN Syarif Hidayatullah Jakarta.
Ladies and gentlemen, now we would like to invite Professor Dr. Veterinarian Niluh Putu Indi Darmayanti, Master of Science from the National Research and Innovation Agency, as a keynote speaker in this international conference. To the Honorable Professor Dr. Veterinarian Niluh Putu Indi Darmayanti, Master of Science, the time is yours.
Hello, can you hear me? Hello, can you hear me?
Yes, Mrs., we can hear you.
Okay, thank you. The Honorable, Rector, UIN Syarif Hidayatullah Jakarta, Professor Dr. Hajah Amani Lubis, the Honorable, the Dean of the Faculty of Health Sciences, Dr. APT Jilhadia MSc, and all the participants on this conference. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. On behalf of Chairman National Research and Innovation Agency, Bapak Laksono Trihandoko, I would like to thanks to committee that invite BRIN today on International Conference Health Sciences. In this conference, I will deliver a presentation with the topic that was requested by committee, namely Global Health Partnership for Sustainable, Equitable, and Healthy Community. Before I start my presentation, allow me to introduce myself. My name is Niluh Putu Indi Darmayanti. I'm a chairman of research organization for head of BRIN. I hope after this conference, we will work collaboration with faculty head of sciences of UIN. May the committee, could you help me to share the screen? Oh, okay. Okay. A slide. Next slide, please. Committee, can I share for myself because the screen in my computer is very little, so I cannot read the presentation. It's okay for you?
Yes, Mrs.
Can I share for myself?
Yes, Mrs. Yes, Prof.
Thank you. Okay. As we know, the can you see my screen? Can you see my screen?
Yes, Prof. We can see your screen.
Okay. Okay, let's start. So, as we know, WHO engages with the both global health partnership through engaging in their governance structures and providing leadership on technical and health system approaches. So they involve the government, civil society, international organization, the private sector, and affected communities under an umbrella framework. So their goal is to achieve health improvement that no organization could achieve alone. WHO, for example, global WHO collaborate with the EU and its institution to protect and promote people's health around the world. The partnership have grown significantly in recent years in recognition of the importance of global health and the need to prepare for and respond to the rapid changes taking place throughout the world that are presenting new and formidable challenges to health system. With their emphasis on equity, the Sustainable Development Goals encompass our shared, ambitious global commitment to ensuring universal health coverage for everyone leaving no one behind. The EU recognized WHO's central role as a leading and a coordinating authority in addressing global health challenges. The EU has also committed to taking a proactive, coordinating, and leading role in the inclusive process to reinforce global health security and to strengthen WHO, in particular, its preparedness and response capacities in health emergencies. The important and multifaceted partnership covers political and strategic initiative and their implementation at the global, regional, sub-regional, and national levels. It is framed through a memorandum of understanding and a regular high-level strategic dialogues that lead to alignment and synergies in key areas of global public health, as well as a shared commitment to achieve a result. The partnership brings the transformation at the country level, assisting national authorities to strengthen their health system, achieve universal health coverage, and improve capacities to prepare for, prevent, and respond to health emergencies. It also enables countries to better apply to one health approach to global challenges, address to health impact to climate change, make their environment healthier, and help their population improve sexual and reproductive health, and keep communicable and non-communicable disease at bay. Global health partnership have the potential to make a significant contribution to addressing equity issues. They could and should focus on first one, for the diseases with the greatest impact on the poor and the marginalized, and countries with the greatest social economic need, addressing the need of the poor people and women within individual countries. So most global health partnership claim to be pro-poor, and overall they do target diseases affecting the poor disproportionately. So, for example, for analysis, suggests that only the whole GHP allocation by disease, for example, pro-poor as for allocation, perhaps more pro-poor for the malaria, slightly less so for the HIV/AIDS. SDGs and global health research as the Sustainable Development Global Goals and global health research for disease covered by global health partnership resources are more focused on low-income countries than recent donor commitments. for example, for the vaccine fund or Gavi support is restricted to countries below $1,000 GNE per capita. However, individual global health partnership tend mostly to lack specific indicators or measures for equity aims. At country level, they cannot show that the very poorest people are benefiting and most lack specific objective to work with country partners for delivering such impact. The majority of the global health partnership can provide evidence of increased coverage attributable to their work, and this sometimes taken as a proxy indicator. For examples,
Recording in progress.
vaccine fund can adopt a strategy or of increasing immunization coverage given research finding, and that the differential in access between the rich and the poor tends to decrease the increasing average immunization coverage. So recent study of drug access partnership noted by widely held conclusion at the country and global level that such a partnership have the indeed assisted the poor to access necessary drug data to support this remain limited and indirect, but the study found the conclusion reasonable given the nature of the diseases. Generally, high level of program coverage and the fact that the drug are provided free and in unlimited amounts to recipients. So, how the global health research partnership? Since COVID-19 transcends a national border, global partnership and collaboration are needed towards the development and assessment of technologies, including vaccine and therapeutics, required to contain this and other health threats in order to benefit global health and the economy. The importance of the such partnership is this area is globalization has been reinforced by 17 Sustainable Development Goals, which provide the framework for promoting sustainable and equitable development, including global health research, for example, for the next 15 years. This is to ensure the such a global health research partnership are meaningful and mutually beneficial by addressing local health concern and promoting a long-term value for the communities involved. On the slide, you can see the Sustainable Development Goals, SDGs, the transforming our world in 2030 agenda for sustainable development was adopted by head of the state and government at the special summit of the United Nations on September 25 to complete the global development agenda begun by the predecessor by Millennium Development Goals. So the core global health focus area to be addressed, and you can see on the table 1, the agenda of the Sustainable Development Goals. There were 17. For example, SDG 1 for no poverty for the goal description, and SDG 2 for zero hunger for the goal description, and SDG 3 for goal good health and well-being. So in SDG 3, the focus area to be addressed to 4 focus, namely the global epidemic of the HIV/AIDS, tuberculosis, malaria, and other communicable diseases. Reduced by 1/3 premature mortality by non-communicable diseases. Reduce infant and under 5 mortality ration and maternal mortality ratios. And the fourth is the promote universal access to safe, effective, quality, and affordable essential medicines and vaccine for all. So SDGs and global health research is important of the SDGs in the context of global health research. Is the SDGs 3 may provide a reference point from which research partners can start their discussion to identify and reach consensus regarding the priorities. The goal calls for improving access to technology and knowledge to facilitate and sharing of ideas and innovation. Global Health Research Partnership hence falls under this purview. If you can see on the slide, SDG 17 target area for focus already identified, namely finance, technology, capacity building, trade, and the systemic issues. So how the power differences at the play when researchers from the high income are seeking research of a grant funding for researchers in ICHS have been reported as a major source of a disparity between potential partners in LMIC and provide the former with the undue power advantage over the latter with whom they seek to collaborate. These disparities working in the favor of the researchers from the high-income countries may make it easier for them to dictate the term of the partnership or collaboration with those in low-middle income countries, including the research agenda settings, priorities, and authorship. In context with the social determinant of health and disease burden in low-middle income countries, serving at the location for the global health research, such as the SDGs, provide a framework by which countries around the globe can be objectively evaluated with respect to their prevailing social determinants of health. And then combination of low research funds, relatively poorer social determinants of the health and higher burden of diseases of the global health importance increases the vulnerability of exploitation. There is a need to highlight the nature of the global health research partnership and collaboration between high-income countries and low-middle-income countries in the context of the SDGs. How we can create the global health research partnership? The need for the global research partnership to be developed, taking full recognize of the differences in the social determinants of health of the partners, including the social, cultural, and political contextual improvement of the research location. So this consideration should ideally exist in prioritization research focus areas to meet the specific needs and aspiration LMEIC communities, increase research relevance, and optimize the long-term impact of finding. So a global health research partnership must be evolving, and partnership are key component of both framework. Health partnership as contextually relevant peer-to-peer collaboration with our platform for sharing knowledge and growing expertise globally, working towards common goals across disciplines and perspectives. Making a case community-based participatory research, CBPR, a viable option for the global health research partnership. So the CPBR approach are particularly suited for the global research, global health research. In the second one, for the take into account the prevailing social determinant of health, which have been identified frequently as the root causes of the global health disparities, and the second one in line in the vision of the WHO for the Global Health Partnership, and the third one is the CBBR recognize the individuals are embedded with the social, political, and economic system that shape behaviors and access to resources necessary to maintain health. So CBBR greater relevance and the value to all parties concerned, share the responsibilities and expertise, health and well-being of the communities are improve the quality and validity of the research. The proponent of the CBBR describe its research approach that depend on equitable partnership involving the sharing of expertise, responsibilities, and ownership of the research process between academic research partners and their non-academic community partners in order to enhance to understanding the of a given phenomena in global health research. There were three of the different CBBR, depend on model approaches available. So the second one is single theme model collaboration between a university-based center and a community or organization. And at the second one, the CPBR model is described as the targeted area-based collaboration between academic researchers and a small group of community organizations. And the third one, the CPBR model describes the consists broad-based coalition of two or more academic institutions with multiple stakeholder organizations in a given geographical area working on a long-term basis. So we propose how we can implement the global health research partnership in national level, such as Indonesia. So by undertaking community-based participatory research as a viable option for research partnership in the context of the SDGs, taking consideration in development strategies. The first one is helping low-income people, minority groups, and ethnic groups, local and regional planners and policymakers make fair, healthy, and sustainable decisions for all residents that meet their needs and that reflect their values. Both relationship among community-based organizations, residents, community development companies, business owners, local and regional decision makers, and the others interested in growth and development issues. And the third one is the built-in capacity of the community-based organization that simultaneously identify the goals and needs of the citizens and both the knowledge they need of to shape a development. And the fourth one, ensure the development policies in the line with the vision of the community can be integrated into comprehensive plan. So have the last one is the help communities develop their vision for the future, identify strategies and policies to achieve them and create a equitable, lasting, and authentic development. So our conclusion in our presentation is the Sustainable Development Goals provide the framework for the global sustainable improvement, social and economic growth while seeking to protect the planet for future generations. Will SDGs 3 focus directly on promoting, improving, and sustaining health globally, and other SDGs do the same, albeit indirectly. SDG 17 is important, is calling for a global partnership to facilitate the achievement of the other 16 goals, including SDGs 3. So this all my presentation. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much to the Honorable Professor Dr. Niluh Putu Indi Darmayanti for the keynote speech. And we also need to know that Professor Dr. Niluh Putu Indi Darmayanti is a chairman of Research Organization for Health at National Research and Innovation Agency. Now we would like to give Professor Dr. Niluh Indi Darmayanti a certificate for her contribution as a keynote speaker.
Thank you.
So here it is the certificate. Thank you very much, Professor Dr. Niluh Indi Darmayanti, for attending this international conference.
Thank you, Ibu Rektor, Ibu Dean. Thank you. I hope we can create a collaboration with your faculty, with the research organization for health of brain. Thank you. Good morning, everyone. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Respected participants, we would now like to introduce the moderator for our first plenary session, Mrs. Narila Mutia Nasir, PhD.
We will first read the brief introduction about our moderator today. She is Mrs. Narila Mutia Nasir, PhD. She is a senior lecturer in Faculty of Health Sciences UIN Syarif Hidayatullah Jakarta since 2003 till present, and she is also a Secretariat General Indonesia Public Health Association in Jakarta region since 2020 till present. She had her doctoral degree in Osaka University, Japan, School of Human Sciences since 2009 to 2013. And she has published 25 publications, including journal articles, books related to maternal and child health, reproductive health, health promotion, and COVID-19. And she is also active in community service as a speaker and an educator of health on reproductive health issue and health behavior. Without further ado, we invite Mrs. Narila Mutia Nasir, PhD, to take over the plenary session. To the Honorable Mrs. Narila Mutia Nasir, PhD, the time is yours.
Okay, thank you Dinda and Irzan. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. First, I want to say my greetings to Honorable Professor Dr. Hajah Amani Lubis, Master of Art, Rector UIN Syarif Hidayatullah Jakarta, the Honorable Dr. Zilhadia, Master of Science Pharmacist, Dean of Faculty of Health Sciences, UIN Syarif Hidayatullah Jakarta, the Honorable Professor Dr. Veterinarian Niluh Putu Indi Darmayanti, Master of Science from National Research and Innovation Agency, all speakers and participants. We warmly welcome you to the second International Conference on Health Sciences to 2020, organized by Faculty of Health Sciences, UIN Syarif Hidayatullah Jakarta. The conference theme this year is Global Health Partnership on Addressing Socio-Religious Determinants for Sustainable and Equitable Health Development. Please allow me, Narila Mutia Nasir, as your moderator for this plenary session. We know that we are still facing COVID-19 pandemic, and within 2 years, many things happened. And we realized that this pandemic has impact on many sectors, economy, social, and of course, health. From this situation, we have learned so many things. We see the complexity of facing health problem. We know that we cannot do this all alone. We need a global partnership. So today, in this morning plenary session, we will have 3 amazing speakers. We have Professor Dr. Hitoshi Oshitani from Tohoku University, Japan, Assistant Professor Dr. Ponchai Julamat Eran from Burapa University, Thailand, and Professor Dr. Aisyah Adam from Homemade Group Malaysia. So let's start with our first speaker, Professor Dr. Hitoshi Oshitani from Tohoku University, Japan. Let me share his curriculum vitae first. Professor Oshitani is a professor for the Department of Virology of Tohoku University Graduate School of Medicine. Before joining Tohoku University, he was a regional advisor of the World Health Organization Western Pacific Regional Office in Manila, Philippines, from 1999 to 2005, where he was responsible for emerging disease, including severe acute respiratory syndrome SARS and avian and pandemic influenza. He worked as a technical expert for Japan International Cooperation (JICA) in Zambia from 1991 to 1994. His main research interest is epidemiology and control of viral infection, particularly respiratory viruses such as influenza and respiratory syncytial viruses. His research group has been conducting research in Japan and other countries such as the Philippines, Mongolia, and Zambia. He is also a member of the advisory board and the subcommittee on COVID-19 measures for the government of Japan. Today, his topic is about global health partnership, how to start. Sensei, please, you will have 30-minute presentation and we will continue with question and answer for another 15 minutes. So please, for the participant, you can write down your question later through Zoom chat. And for Sensei, yoroshiku onegai shimasu. Is Professor Oshitani already here? You would like to present by yourself, Professor?
Okay. So I couldn't unmute. So
okay. Same with me, Sensei.
So thank you very much for introduction. My name is Hitoshi Oshitani. The distinguished participant and the pleasure to be at this international conference on health sciences. And today my role is to introduce the concept of the global health. So I'm also deeply involved in the COVID-19 response in Japan and other countries. But today I will give more the bigger picture on global health to introduce the concept of the global health. And we've been doing the research in the Philippines, Indonesia, and some other countries, particularly on the pediatric pneumonia. So I will briefly explain what we have been doing in terms of pediatric pneumonia research. And I don't think I have enough time to explain all aspects of global health, including the global health security for COVID-19 and the other pandemic threat. So as I mentioned, I will just give the brief overview of global health from the historical perspective, and then I will explain what we've been done in terms of the pediatric pneumonia research in different countries. So the next slide, please. As you probably know, before the end of World War II, many countries were under the colony of different countries, particularly under the European countries. And so this slide shows the countries and the different nations in 1945. As you can see, the main countries were under the colonies of the different countries. And the next slide, please. and as the chairperson introduced, I was in Zambia for about 3 years in early 90s, and this is the map of Zambia, and the capital of Zambia is Lusaka, but the red arrow indicate the location of the city called Livingstone, and this the Livingstone, there is a famous the Victoria Falls. It's the very famous the tourist the attraction in Africa. But the more than 100 years ago, the European moved to Zambia, and they created the city the Livingstone, but many of them have died because of malaria. The Livingstone is the located at the lower the place, and that's why the malaria was endemic. And then they moved to Lusaka. Lusaka is the current capital city. Lusaka is on highland, and as you probably know, the capitals in the African countries are located on highland because of the threat of malaria. And the next slide, please. And the Panama Canal was constructed in early the 20th century, and the France and the US they constructed this the canal in Panama, and but the many workers they also died because of malaria and also yellow fever. There was the huge yellow fever outbreak around that time. So the next slide, please. These are the famous the School of Tropical Medicine in the world. The left upper panel is Liverpool School of Tropical Medicine. In the UK, the London School of Tropical Hygiene and Tropical Medicine is very famous, but the Liverpool School of Tropical Medicine is also famous. And the Liverpool Tropical Medicine was established before the London School. And as you know, the Liverpool is a port city, and also the Trent University, the left lower panel, is a Trent University in New Orleans in the US. This is also the oldest tropical medicine school in the United States, and the New Orleans is also port city. And also in Japan, we have only one the Institute of Tropical Medicine in Nagasaki. And Nagasaki is a western part of Japan, and which is very old, the port city. So these school of tropical medicines were established in port city because there was the need to address the tropical medicine when they went to other countries to colonize the countries and to make any development in the other countries, particularly in tropical countries. The next slide, please. Then after World War II, many nations became independent countries, including those in Africa and Asia. But then the big issue after World War II was the huge difference between the rich country and the poor countries. And at that time, we called it developed countries and the developing countries. And there was a huge difference in terms of child mortality. Child mortality data in 1980 is presented in this slide. And also the next slide, please. Also, the life expectancy in 1980, there was a huge difference, and between countries, the Japan, Europe, and North America, Australia had already the higher life expectancy in 1980, but many African countries and Asian countries had the much lower the life expectancy in 1980. Next slide, please. And also there was the huge difference in terms of the income of the nation. And this slide shows the GDP in 1980, and US, Europe, Japan had the bigger the GDP, but in most of the African and the other Asian countries had lower the GDP. Then the next slide, please. Then framework of international health was created around that time because of the huge difference between countries. Can you put them? Yeah, can you go ahead? You can show more. So this is the framework of international health, and you can press more. You can go ahead. So basically developed countries, or the rich country, they help the developing, so-called developing countries, the poor countries. And the international organization like WHO is coordinating to such the support between countries from the rich and poor countries. So this was the framework of international health. But the next slide, please. But the child mortality was decreasing in many countries, and also the most of other health indicators, they improved in many countries, particularly in Asia. There's still many African countries are experiencing the high child mortality rate and low life expectancy, but the many Asian countries are now in much better position in terms of health indicators. Next slide, please. And the life expectancy is also improving in many countries. There's still some countries, like I said, some African country, Afghanistan has a lower life expectancy, but even they are much lower, but they are still improving. And the difference between the high income and the low and middle income countries is getting smaller now. The next slide, please. And the GDP, in terms of GDP, now, as you probably know, the number one is the US, and number two is the China. And so the boundary between the developed, so-called developed and the developing country is getting unclear. Some countries like India, Indonesia, Brazil are also more development in the past the decades. And next slide, please. And the rich country is not that rich anymore. And the Japan and the Europe, US, they had provided the huge amount of official development aid to other countries. But this slide shows the Japan's ODA budget, the trend of Japan ODA budget. As you can see, our ODA budget in Japan is decreasing significantly. It was peaked around late 90s. And you probably know JICA, Japan International Cooperation Agency, and the JICA has been providing a lot of the technical and financial support to the low and middle income countries. But the ODA budget is shrinking in many countries, including Japan. The next slide, please. And also the issue related to global health is the more complicated, and due to the globalization and emerging infectious disease such as COVID-19 and the pandemic influenza, these are not issue in single country. And also now there is the big difference the within country. So for example, there is the huge difference between poor and rich in almost all countries, including Japan, Indonesia, and some other countries. So the global health issue is much more challenging and complicated, and we have a climate change and other things. And the next slide, please. And also at the same time, we have the increasing needs, different needs in global health. We have the still existing problem, such as poverty in Africa and some other countries. And we still have the infectious disease like TB, the HIV/AIDS, malaria, and the pediatric pneumonia, and so on. But in addition, we have the new problem in almost all countries. Many countries are experiencing the increasing trend of non-communicable disease, including in Indonesia. And we have now emerging disease such as Ebola, the COVID-19, and the pandemic influenza. So we are now having new problems. And at the same time, we still have the existing problem. So the low and middle income countries are having the so-called double burden of the disease. You still have the infectious disease problem in many low and middle income countries, but at the same time, you have the emerging issue of non-communicable disease like diabetes, hypertension, and so on. And so there are increasing needs in the global health. Next slide, please. So, and the impact of current global health issue is on all countries, including low-income countries, middle-income countries, high-income countries. The COVID-19 had the probably more impact in the high-income countries. Right now, we are having the outbreak of COVID-19 in Japan, and many people, particularly the elderly people, are dying every day. Yesterday, we had over 300 deaths reported due to COVID-19. So it's the COVID-19 has impacted all countries, virtually all countries in the world. So the global health issue is more complicated. And next slide, please. So we need the more coordinated approach, not like the so-called international health, just the rich countries is helping poor countries, but we need the more coordinated approach for global health issues. Next slide, please. So this is the comparison between international and the global health. And international health was dealing with the issue mainly in the low and middle income countries, and the global health is dealing with a global issue. And the multi-country approach is necessary for global health. But for international health, it was the relationship between the two countries, the rich and poor countries. And we need the interdisciplinary collaboration for the global health. The next slide, please. And the WHO has been playing an important role in international health, but in global health era, the role of WHO is questionable. And next slide, please. This is the WHO headquarters in Geneva. I used to work in the WHO, the Western Pacific Regional Office in Manila, Philippines, and I often visited the WHO headquarters. And the next slide, please. And Dr. Tedros is the current Director General of WHO. And next slide, please. And the WHO budget is not that big. And WHO budget is actually not increasing significantly. Although there are many different global issues, including COVID-19 the environmental health and so on, the non-communicable disease and so on. But the WHO budget is not increasing significantly. And the next slide, please. And the WHO is playing the many roles, and these are the core functions of WHO. And so setting the research agenda, setting the norm and the standard, like the water quality standard and so on. That is also the important WHO role. And also providing the leadership and technical support. Technical support is mainly provided to low and middle income countries, particularly in the African countries. Next slide, please. So this is the previous framework. There was national government and the WHO, in international health, the framework. WHO was playing the major role in international health, and there are some partners, even before. And the next slide, please. So this is the example of the historical partnership between WHO and the non-governmental organization. Rotary International, as you probably know, has been providing the huge financial support to WHO for polio eradication program. And unfortunately, polio has not been eradicated yet, but the Rotary International provided a lot of the financial support to WHO. And the next slide, please. So this is a historical example, but the new issue is more complicated. The HIV/AIDS is also complicated issue, and there are many the different aspects of the HIV/AIDS. And next slide, please. That's why the UNAIDS was created in 1994. In addition to WHO, UNAIDS is under UN, the United Nations, and so it's independent from the WHO, because the HIV/AIDS has a many multidimensional aspect. So that's why the many UN organizations like UNICEF, UNDP, and so on, they were involved in the creation of UNAIDS. And next slide, please. And the Global Fund was created in 2002, and this is a financing mechanism for 3 infectious diseases: HIV/AIDS, TB, and malaria. And they are providing huge grant to the low and middle income countries for these 3 diseases. Next slide, please. And there are the many non-governmental organizations, and role of these non-governmental organizations is increasing. Save the Children, the Doctors Without Borders, the PATH, and so on. And the next slide, please. Particularly the Bill and Melinda Gates Foundation, they have the huge budget. Actually, their budget is much bigger than WHO budget. And they have the more influence on global health, including the WHO activities. And then next slide, please. And also the public-private partnership is an important component. As you probably know, the Gavi is the public-private partnership. The pharmaceutical companies, the vaccine, the producing companies are providing the funds, and the WHO and the technical agency are also involved in the Gavi. The next slide, please. And this is the Gavi business model, and you probably know this, so I will skip this. And the next slide, please. So now there are many players in the global health, not only the national government and the WHO, but also the international NGOs, the regional organizations, and so on. There is in Africa, there is African CDC, and so the regional organization playing more important role, and private industries are also playing the important role in global health. So there are many players. Next slide, please. And now WHO is under reform, And so the WHO, the need to change their way of working under global health. I still believe that the WHO should play the important role in the global health, including emerging disease issue, but the WHO need the more the comprehensive reform to meet the global health needs in the 21st century. Next slide, please. So we've been doing the pediatric pneumonia research, and as I mentioned, I will briefly explain what we've done in terms of the pediatric pneumonia research in my department. Next slide, please. So pediatric pneumonia is still the important cause of death in children, particularly in low middle income countries, especially in Africa. But there's the limited evidence. So that's why we started pediatric pneumonia research over 15 years ago. And next slide, please. In the Philippines, we have a collaborative research center at the Philippine Research Institute of Tropical Medicine, RITM, and we've been doing the various researches in collaboration of the RITM. And next slide, please. And we also received the quite large research grant from Japanese government. The lower one is particularly for the acute respiratory infection, including pediatric pneumonia. And next slide, please. And this is our project, which ended in 2016, but we are still continuing the research on acute respiratory infections in the Philippines and some other countries. Next slide, please. And so etiology study was conducted in the different sites. And the next slide, please. Next slide, please. And we also did a cohort study. We are still doing a cohort study in the Philippines. And we have two sites, the local site in the rural areas for the cohort studies. And the next slide, please. And this is one of the site, the small island. In this island, we've been doing our cohort since 2014. And next slide, please. And this is the design of cohort study. I'll skip this, and the next slide, please. And we have published many papers, over 50 papers in international journals on respiratory and diarrheal disease in the Philippines. And the next slide, please. And we also did this core-to-core program that's supported by the Japanese government grant. And the State Islamic University of Jakarta was also partner for this the project. The next slide. And we did the pilot project in Cambodia, Indonesia, Zambia, but unfortunately, due to COVID-19, we could not continue some of the research activity. We also obtained some other research grant, but it's quite difficult to visit these countries right now. And the next slide, please. But they published this paper in collaboration of State Islamic University of Jakarta, and so Dai Hana-san, there was the PhD student in my department, and we did the study on the use of antibiotics for common illness in children. So I hope that we could restart this kind of collaboration. Because of COVID-19, we could not continue this kind of research activity in the other countries, but I hope that we can restart some of the research collaboration. And the next slide, please. And thank you very much for your attention. I'm happy to answer any of your questions.
Thank you, Sensei, for your presentation. It's very
valuable presentation. We know about how the global partnership. And is there any question from the participant? You can write down in the chat. So, Sensei, in your experience, is there any barrier to do the global partnership during your experience in Africa and other South Asian countries, for example?
There are many actually barriers. To conduct the research in other countries, we need the research funds, and it's not easy to get the research funds. And also the sometimes your priority does not match our priority. So we need the lot of discussions to set the research, the agenda, and also the who should do what kind of role. So this kind of thing is the time consuming. We need a lot of discussions between us and partner institutions in the different countries. I hope in the Philippines and also in Indonesia and some other countries, we managed to conduct some research, and I hope we can do more research.
Okay, so actually the hardest part maybe how to start the collaboration, yeah, Sensei. I mean, to have a similar frame to do the partnership, right? So and you say that like WHO actually they don't have much money for that, so it means that we really need a the public and private partnership for this, right?
Yes, actually WHO doesn't have a much the research fund, and WHO does provide some research fund, but it's not that big. And so the private the industries also playing an important role in research, but they also have their own agenda. For example, pharmaceutical companies want to sell their products, and we need to have the balance between the real research need and their needs in promoting their products and so on.
Yeah. So your experience for the research in Indonesia, I saw that one about antibiotic, right? What is the challenge for your kind of activity during in Indonesia?
It took so much time to design the study, and the sense that we do not know the local system in Indonesia, and so we have to visit the local site many times, and then we also have to get approval from ethics committee, IRB, and so on, and so it usually taking a lot of time, and it's not that easy, but we have to overcome all these challenges to conduct research in other countries.
Okay. Sensei, we have another question from the participant. She said that it's from Dita. She said that I have one question. What is the most important component for global partnership? The most important, Sensei.
Probably the most important part of global health is the setting the goal for the global health. So the SDGs, as the previous speaker mentioned, the Sustainable Development Goals, the important direction, providing the important direction for us, and so we should have a common goal. for global partnership. And otherwise, if we are just interested in publishing the paper, then the partnership doesn't work. So we need to understand your needs, and that we have to share the common goal to conduct research.
That's so common goal. So was there another question? Was there any difficulties because of differences in national or local regulation or social value in doing global cooperation research? I mean, you have experience in Africa, in Zambia, in Indonesia, in the Philippines. So how you manage such kind of different? It must be different, right? So how you manage the national, local, or social value?
It's quite different, and for example, in the Philippines, there are big difference between the rural and urban areas, and also the rich and the poor people, in many aspects. For example, health-seeking behavior are quite different, and so we need to understand such local the context. We conduct our research on the influenza disease burden in the Philippines, but in the rural, it's not that rural, but it was not in Manila, and it was conducted in the city called Baguio, in the northern part of the Philippines, and actually the many elderly people do not come to the healthcare facilities, even if they are very sick, and many of them actually die at home. And if we conduct the such study in the hospital, we cannot capture the many deaths. So then there are many such issue, the local challenges to conduct the research, and we need to understand the local behavior and so on. It is not easy, but
okay. So to make it smooth, we need to understand and know better about the local value, about the behavior in site research. Yeah, Sensei.
Yeah.
Sensei, actually, I really want to discuss more with you about this a very interesting topic, but we have a limited time. So let me share. We want to show our appreciation on the behalf of conference committee. We would like to present a certificate of appreciation for your contribution as speakers in our international conference on health sciences 2020. Thank you very much, Sensei.
Thank you very much.
Thank you very much.
Thank you.
Okay. Hi. Okay. Now it's time for us to move to next speakers. We have Assistant Professor Dr. Ponchai Julamat, Registered Nursing from Burapa University, Thailand. He was born in Bangkok, June 4. Oh my God. He has the same birthday with me, right? But he was born in 1971, but for me, you don't have to know, right? So he got a Bachelor of Science in Nursing at Songkla Nursing College, Songkla, Thailand. He got Master of Science, Master of Science in Medical Surgical Nursing from Chiang Mai University, and also from European Master in Gerontology from Vrije University Amsterdam, Netherlands, and got PhD in Nursing from University of Porto, Portugal. From 2003 to present, he has a position as Assistant Professor at Gerontological Nursing Department, Faculty of Nursing, Burapa University, Chonburi, Thailand. He also has a 24 international publication. And today, Professor Julamat will present about building partnership for healthy community in nursing. Professor Zulamet, you will have 30-minute presentation, and also we will continue with 15-minute question and answer. I think Professor Zulamet already here, right? Committee? Okay. Hello, Professor. Nice to meet you. Is already okay for speaking? Oh, please, committee.
Okay,
Okay.
thank you very much. So
Okay.
thank you, thank you for the introduction of my background, and also thank you for the invitation.
Okay.
So I would like
Professor.
to show my slide. Wait a minute, please.
Okay. You able to share, Professor?
Yes, wait a minute.
Okay, if before we talk with Professor Ositani about global partnership, but now we will focus on nursing, building a partnership for health community in nursing. So we can enjoy the presentation from Professor Julana. Okay, please, Professor, time is yours for 30 minutes.
Okay, so thank you very much for the invitation for this international conference. I would like to share my experience about building partnership for a health community in nursing. So I would like to share you the story from Thailand. So this is my university. It is located in the eastern part of Thailand. And if some of you ever came to Thailand, you can stop by at Burapha University, just 40 minutes from the main airport. And this is where I work, Faculty of Nursing at Burapha University. And this year we will celebrate our 40 years of establishment. So actually, I serve as a Dean of Faculty of Nursing. However, I work in gerontological nursing department. So I would like to share you about the elderly care multi-professional collaboration of community and home-based care. And I think this is the one of the examples of the partnership. I can say international partnership because this project collaborate with Saku University in Japan, Saku municipality, and also we are from Burapha University, and we collaborate with our municipality where the university is located. And this project funded by JICA in Japan for 5 years and 1 year left for the project. And I think this is one of the global health issue that no countries can deny this one. It is the aging society. You can see from this slide, even in our ASEAN, the older population is getting older. Also in Thailand and even in Indonesia. And you can see how about the aging and age society in our countries. I mean, even in Thailand and Indonesia now, in Thailand we have already almost 20% of the elderly people aged 60 years or over, while the Indonesian is about 10%. And moreover, in ASEAN country, older persons spend up at 10 years with impairment. You can see from this slide, Thailand and Indonesia as well. That's why we think about this, and we start the project 3 years ago on community-based comprehensive elderly care project in our area. And as I said before, this is the project funded by JICA, and we work together for 4 institutions, both in Thailand and in Japan. So first of all, you have to have the policy. So this is the mayor of the city where our university is located. So he mentioned that it is one of his policy and objectives in order to manage the aging society in the city where he is a leader. From that policy, so we cooperate with our partners from Japan. So in this city, the 2 males in the middle are the mayors of the 2 cities. I mean Sansuk city where we are, and the Saku municipality, and also 2 presidents of the university and our partners when we start the project. So these are the peoples, they are health volunteers. So we are, as the nursing institution or university, we need to partner with our people in the community. That's why we invite all health volunteers who are the main worker, the main important person who works on healthcare in the community. So when we start the project, we invite them to participate and to know about the objective of our project in order to have a good collaborations. So in this project, we have main outcome for 5 outcomes to make them understand the policy focus on strengthening elderly care in Sansuk municipality. The second one is community healthcare committee is organized because we don't have this kind of committee before. And then we have home visit that we learn. Actually, we also do home visit, but we learn from Japan side. And then we try to arrange the home visit care do in their communities. And the fourth one is continuing morning exercise, that in the health promotion exercise, and the outcome is we would like to train our staff in order to take care of the elderly people. These are the main outcome of our project. So this is the location that where we implement our project in our city. So this is a little bit out of date, but some years ago, these are the numbers of population aging in our city. You can see that it is increasing from 12.5% in 2014, and in 2016 during our project, it is about 14% of the elderly people. And we can see about male and females in every age of elderly people. So when we start the project, we ask them to be trained with the local and international staff in order to make them understand the activities and the meeting of the project. And also we health professionals to be trained in Japan for 2 weeks. And then the health volunteer also goes to Japan in order to learn how the Japanese take care of the elderly in the community. So the first group of health volunteer went to Japan during this day in Nagano. And then when they go there, they were interviewed by the news reporter in Japan. And I just want to share you some I don't, this is Japanese, it forget it. So the mayor welcomed them, and also so they were trained in Saku University. This is the simulation how to be the older people and how to do rehabilitation and exercise in Japan. So this is the bathtub that in Japan it is very traditional and very common for the elderly who will be taken care by the health volunteer. And this is one way of teaching health education to their people. So we also learn how to do this, and they have to show what they are going to do. So this is the way of they exercise the elderly mouth before eating meals. So there are 10 steps in order to exercise the mouth of the elderly. And you can imagine these are the instruments that they use to take care of the oral health of the elderly in Japan. You can see they are very fluent. And this is the way that they take care of the elderly in order to have meal. So this male, he has dementia, so we need to take care of them. And they learn how to transfer the patients, the elderly, from the home to the institution. And we also observe the elderly care in the nursing home in Japan in many activities and in many institutions. So when they come back to Thailand, we would like them to bring their experiences to implement in the community in Thailand. So when these health volunteer came back to Thailand, we start our work as the Japanese do. So we have each profile of the elderly, and this is the document that they need to assess health of the elderly in the community. So one health volunteer is assigned to take care about 10 to 15 elderly in the community. And so we have the care plan for each elderly. For the healthy group, we do the health promotion in each in each area of the community. This is the nursing instructor that they join to be trained in Japan as well. So the health promotion activity by nurses also implemented in the community. So this is the square steps that it is very famous also in Japan and also in Thailand. So our nursing staff also go to the community to take care of the elderly according to their experience from Japan. And during our project, we have also some Japanese experts visit to our community in order to take care the people and also to train our health volunteer and health professionals. So we also do home visit in many patient house, and also during the home visit we also train the professionals in Thailand. So these are the activities. They are train our health professionals with the health volunteer and also the other health professional staff in Thailand that who cannot go to Japan. And then the trainee are going to the community to provide a service to the professionals as well. And when we go to do home visit, we have medical doctors, we have nurses, and also we have physical therapists, including the health volunteer, to do home visit as multidisciplinary team. And you can see this is the way that we take care of the oral health. If you remember the picture that I showed before, the mouth exercise. So the health volunteer also do mouth exercise with the stroke patient. And surprisingly, after 3 months, this man can swallow his food by himself. So we promote this, the mouth exercise with the elderly also. And also we have multi-professionals and to do post-conference of home visit of each patient. So it is including medical doctors, nurses, health volunteer, and the health professionals in order to discuss and to do the conference after the home visit. So we also continue doing home visit with the multi-professionals. So every elderly have to be taken care by the physical therapists and the volunteers together in order to help them. So in Thailand, we have so many Thai herbs, and I am sure that in Indonesia, you also have this kind of herbs. So the health volunteer and health professionals also use this in order to rehabilitate the patients at home. So we do it with the stroke patient. So these are the examples of the patient that they are rehabilitated about 3 months. You can see this man is 73 years old with stroke and weakness, so he cannot stand and walk to the toilet. So after 3 months of rehabilitation, he can walk to the toilet by himself with some minor support of the caregivers. So we have our wisdom in order to rehabilitate the patient. You can see they use their traditional clothes in order to do exercise or rehabilitation at the home of the elderly. So this is very good example. This man, he used to work in our university, and then he had an accident for some years. He lie on this bed for many years, you can see, and he has never stand up. So when we exercise him, and we try to encourage him, you can see his face. He does not want to sit on the floor because he has never get up on the bed. So when we encourage him to stand up, he also look at the ceiling because he fear of falling. But finally he can stand up. So we do with many elderly in our community. As Professor from Japan said before, the elderly is one of the issue of the global health, and especially when the elderly in the middle income country or poor country, they need home care because they cannot access to the health services. So after the first year, we have been followed up by the JICA and SACU team in order to evaluate the outcome of our project. And you can see. So we also learned from Japan that we would like to have the health festival that the Japanese used to encourage their people in order to take care of themselves. So we learn from Japan and then we do it in our city as well, the Bang San Health Festival. And from this collaboration, I think the commitment between the two mayors and also the commitment from the elderly is one of the most important or the most key success for the partnership between institution and the community, and also the collaborations between every partner in order to make the project comes to. So the collaboration between the city, the collaboration between the people in the community, the collaboration between the institution, nursing institution of both Thailand and Japan. And I think these are the message that I would like to share with you in this period. And also during the COVID-19, so we also do, this is the other message that I would like to share you in few minutes, that during the COVID-19, the collaboration or the partnership between university and community, that we do platform in order to take care of the people who get COVID-19 in our area, in our community. Finally, we win the technological and digital innovation of the year. So we win this year in Japan. So we produce We Save at Home by BUU. This platform organized by nursing faculty with the partnership of the other faculty, for example, the faculty of engineering, faculty of medicine, and faculty of health science. And also we collaborate with our community in order to take care of our people. So finally, we received this award, 2022, the Time Higher Education Award in Asia in Technological and Digital Innovation of the Year. So thank you very much for giving me a chance to share our work. And I am really welcome for all of your questions and comments. Thank you very much.
Thank you, Professor Julamat, for your presentation. It's very nice to know the situation in Thailand and the pilot project about this. And we have a question. It's a very interesting to know what you did in community for elderly. The question is there any involvements of the university student in that program? So you said that the partnership is between the city and also the university. So how about the student in your university? Were they involved in the program also?
Yes. So we include our nursing student, medical student, and from faculty of allied health science to join together in this project. So they come together like a IPE, International Professional Education, interprofessional education. So they go together in one house and then they assess the situation of the elderly and they perform their background. Nursing student perform nurse care, physiotherapy student, they perform their, and medical student also. So we include our student as well.
Oh, it is the part of your curriculum in your university, or it's just part of like internship?
Yes, it is because we use the IPE, International Professional Education. So we talk together with the 3 faculties and we arrange the schedule together. So it is one part of our curriculum.
Oh, okay. So it's already part of your curriculum. So it's very easy to to involve the student from medical and also nursing or public health in one place. Yeah. So
Yes.
how about the sustainability of the program, Professor? I mean, because you start 3 years ago, and then you know that it's like the challenge for us if we have a pilot project or program is how to maintain the sustainability. So how did you do that related to that issue?
You mean IPE or the
No,
JICA project?
the JICA project. I mean, the
Okay.
community based for elderly. So you have
Okay.
such kind of the project, how to maintain the sustainability.
Yeah, so this is the second phase. I mean, we funded by JICA 3 years ago, and then they evaluate our outcome, and they announced that our project is one of 25 projects around the world that JICA funded and has a very good outcome. So they also provide us 3 more year financial support. But unfortunately, last 2 years we cannot do it because of the COVID-19. It just start this September. We will send our health volunteer to do training again. Anyway, during COVID-19, we also do online training. So we keep going on this. So it means that our project is sustainable. The key success factor, I think the cooperation between the institution and also the workers, I mean health professional who works in the community.
Yeah, so
we keep going on that.
So the commitment between the institution, between the community is actually the crucial thing to maintain the sustainability, right, Professor?
Yes, and one more thing, I think it is the leader. If you remember the first, some of the first slide that I showed, the mayor of the city that where I work, so he really focused on the elderly care. And also as I as the dean of the faculty, and we also talk with the dean of medical school and allied health science. So we keep an eye on this and we encourage our staff to work together.
Okay, so as the Professor Ositani mentioned before, actually sometimes the hardest thing, how to set the common goals. In your case, when you set up such kind of project, is there any difficulties to like to have the same perception and the common goals about what you need and what the maybe the JICA need?
So if you see our 2 or 3 first picture, that's we invite all of them, and all of them are, I mean, the key person of the community, in order to make them understand. And I think they know that finally the benefit will go to their population, their people. So this is the key message that we send to them. That's why we have a very good collaboration. And also before the project, the students from the university also practice in the community. So we have very close relationship. But anyway, we also have the difficulty that some of the people do not agree with us. So we try to do one by one. I mean, but the majority agree with us. That is our fortunately.
Oh, okay. So you have a like personal approach to do such kind of thing.
Yes.
Okay. So how about the support from the government to this program, this project?
You mean from the Thai government?
For the community for elderly, the pilot project, you have a collaboration with JICA. And how about the government support? It's the local government or also central government?
Yeah. So the local government, I mean the municipality also support some finance, but not much. The main financial support come from JICA. And the local government arrange the how to say, some other support, but not mainly the financial support.
Okay. Okay, Professor. It's very interesting to know your experience in Thailand about how the part of building the partnership and how the challenge to do that and how to maintain the partnership also. So as our to show our appreciation on the behalf of conference committee, we would like to present a certificate of appreciation for Professor Julamat. Okay, thank you very much, Professor, for your contribution as speaker in our conference. And I hope your sharing experience will be insight for all of us. Thank you, Professor.
So thank you very much, and hope we can maybe we can have collaboration
Of
together.
course, yeah.
If interesting.
Of course, yeah. I think we will learn much from you, especially about the IPA, yeah, because
Yes.
we also start for interprofessional
Yes.
collaboration education also. Thank you, Professor.
Thank you very much.
Julamat.
Bye bye. Have a very good day.
Okay, thank you. Okay, we already have two speakers and with a very interesting topic with or I think we have many new knowledge about this, how to build a global partnership and how to do that, what is the challenge. And now we want to move to the third speaker. We have another special speaker, Professor Dr. Aisyah Adam from Homemade Group Malaysia. Professor, let me introduce her first. Professor Aisyah obtained her PhD in biochemical toxicology from School of Pharmacy, London University, Bachelor of Pharmacy from Pharmacy Faculty, and from Zagazig University, Egypt, and she was also Dean of Faculty of Pharmacy, University Technology, Mara from 2009 until now, and then founding head for University Pharmacy, Bachelor of Pharmacy, University Kebangsaan Malaysia, and then she also interest in fasting cancer, the research about fasting in cancer, functional foods, the phytochemicals in herbs, and microbiota that support longevity and health, those that have antioxidant effect to ameliorate oxidative stress and non-communicable disease in which oxidative stress is implicated. Today, Professor Aisyah will present about therapeutic fasting for metabolic disease. Professor Aisyah, are you here already?
Yes, I'm here.
Okay.
Assalamualaikum
Thank you.
warahmatullahi wabarakatuh. Very good morning. Unfortunately, I'm having a little bit of trouble. I had the video started and it just became, I cannot start the video.
Oh.
So I will try
okay.
to share the screen.
Okay, okay. Thank you for joining us again, Professor Aisyah.
Thank you. I don't know
Okay.
why.
Okay. So maybe you can share first the
Yeah, I'm trying to share the screen here.
Okay.
I tell you what, let me leave this meeting and come back again. Is that okay?
Okay, okay. You can start first. So it's a technical problem, yeah. It's sometimes happen. So we will listen to the presentation from Professor Aisyah, and thank you very much. Professor Ponchai said that if you would like to contact me, please free to send email. So I think this is a very good opportunity for us to build our partnership maybe with Burapa University about this.
I've got it here, but I don't understand why it's the other way around.
Yeah.
Well, let me turn off something because I've got a lighting device on. Let me turn that off. Maybe that was the reason.
Oh, okay. It's your should be what now it's landscape should be
I don't know why. How to change it? Is it possible to change it from there?
I think from the video, you can click on the video setting, video, and then video setting.
Okay. Mirror my video.
And
Original
then
ratio.
yeah, in
White
the corner of right corner, you can find the rotate.
Rotate.
So it's a sign.
There is nothing here on mine. Okay, just 1 second. Okay. Always turn off, hide, enable, see myself, didn't see troubleshoot.
You already click in setting video, and then you can see your picture, and then
Yes, I can see that. It causes
okay, right.
Is that okay now?
Yeah, okay.
Really?
Yeah, it's okay
Oh
now.
yeah, I see the corner now. Yeah, okay.
Okay, good.
Okay,
yeah.
thank you. Let me share my screen.
Okay, please.
And here you are. Share. Am I okay now?
I can see your presentation slide. Maybe the slide. Okay. No.
Okay.
Okay.
Again,
Time is yours.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
And very good morning to everybody, honorable professors, dean, and organizing committee members. I actually is a professor in pharmacy in Faculty of Pharmacy, University Technology Malaysia, and I retired recently, and is doing research for another group right now, which is based in Melaka. So I'm showing you, if you have been to Melaka, you will see that one of the oldest masjid in Melaka is Masjid Kampung Hulu right in Melaka town. And if you come there, you will see very old buildings that are in Melaka. But welcome to Melaka. Anyway. So again, thank you to organizing committee for giving me the opportunity to speak at this conference. Now, I would like to talk about therapeutic fasting because I was reading up a lot on fasting and what it can do to the body. And of course, as Muslims, we fast during Ramadan. So actually, in science, our fasting in Ramadan is given the term time-restricted fasting or feeding because we fast for about 12 hours from Fajar till sunset. So in the scientific literature, when you talk about fasting, you're talking about complete deprivation of food except for water, otherwise known as water-only fasting. This we can classify into intermittent, which we can do alternate day, or we can do 2 days of water fasting per week. And as Muslims, we know this as puasa Nabi Daud. Or we can do periodic fasting, which is minimum of 3 days of water fasting every minimum of 2 weeks or more weeks. Or we can fast for a certain number of hours per day. In Islam, we fast for 12 hours per day, about 12 hours. And then, because many of the researchers found that the people who asked to do water fasting find it very difficult to water fast. So the researchers, especially Professor Longo's group in Southern California, prepared this diet, which is, he called it the fasting mimicking diet because the calorie in this diet is very little, less than 50%, about 3.75 kilocalories of digestible energy. There is low levels of protein and sugars and high fat in this fasting mimicking diet. So the fasting mimicking diet actually produces similar effects to water-only fasting. And of course, there is another term, which is starvation. In lower animals or in eukaryotes, researchers sometimes use the word starvation, but actually this refers to chronic nutritional insufficiency. In higher mammals, can result in degeneration and death. So we can draw this in cartoon form. I think it is clearer in cartoon form, alternate day fasting or puasa Nabi Daud. And here you can fast five days, 1, 2, 3, 4 here, 5 days in a week, 1 day of fasting, 1 day of normal diet, 2 days of fasting, or you can have modified fasting whereby 1 day you take a normal meal, the next day you have very little calories, then you continue with a normal meal, And then you have time restricted fasting like us. We eat only before dawn and after sunset. Or you can have prolonged fasting. Prolonged fasting can be many days of water-only fasting, not taking any nutrients, and then they can break the fast. And then, because people find it so difficult to do the water-only fasting, the fasting mimicking diet was prepared, and of course it's trademarked because it is a business, right? And this supposedly produces similar effects to water-only fasting. We know that fasting will result in ketogenesis, i.e. production of ketones, and will promote potent changes in metabolic pathways and cellular processes such as stress resistance, lipolysis, and autophagy. And there are medical applications for fasting. And when I talk about fasting here, I'm talking about mostly water-only fasting. It was found that the water-only fasting has drugs that are used to reduce seizures and seizure-associated brain damage, and also in reduction of rheumatoid arthritis. In animals, again, the same model that I showed you before. This is because, mostly they do intermittent fasting because animals are small in weight. So you have to give them time to recover their normal weight. Now, of course, when we fast, we know that glucose levels reduce, therefore insulin reduce, and glucagon, the other hormone that regulates blood glucose levels, will increase. And there is increase. This causes increase in glycogen utilization and release of hepatic glucose, the process known as glycogenolysis. Triglycerides, fat, is broken down into glycerol and free fatty acids. Under fasting conditions, tissues will get their energy from the free fatty acids. The brain actually can utilize glucose and ketone bodies, which is produced from acetyl-CoA in hepatocytes. So there is actually a metabolic switch from liver-derived glucose to adipose cell-derived ketones. So when you have reduction in amino acids in the circulation, the pathway responsible for growth, in particular the mitochondrial, the mammalian target of rapamycin, or mTOR, is reduced. So what you produce is reduced cell growth, increase in autophagy, which is self-eating of cells, mostly damaged cells, and regulation of many pathways. All this eventually lead to reduction in inflammation. There are many other pathways that are activated, which lead to other consequences of fasting. So how long do you think we can do water-only fasting? At one time, I thought that we can only water fast, i.e. don't take any nutrient at all. We only drink water every day for 7 days only. I thought, after 7 days, you'll definitely die. And I personally took on 40 days of water-only fasting, not eating anything for 40 days. So the literature says that you can actually do water-only fasting for 60 days, i.e. if you're stranded somewhere, there is no source of food, and we have access to water that has electrolytes, any source of water that has electrolytes, we should be able to survive up to 60 days. So what happens, as we know, when we fast, after utilization of free glucose in blood, and then glycogen, which is the storage form of glucose in tissues via process of glycogenolysis to produce glucose, which is utilized by the cells, then the body will start to break down the fat to produce fatty acids and all the ketones. So if you monitor in humans, you see that levels of the ketones and free fatty acids increase with time. Here you have the levels of these free fatty acids, acetone, beta-hydroxybutyrate, acetoacetic acid, with days of fasting, and levels increase with time. And when obese volunteers who have been fasting for several weeks were monitored, they found that their brains utilize mostly beta-hydroxybutyrate and acetoacetic acid with little utilization of glucose. And these ketones are more efficient fuel than glucose. In the fat state, of course, the brain will utilize glucose only. In mammals, the effects of fasting has been measured. And we know that in the GIT, definitely with little energy being taken in, the energy uptake will be also reduced. Inflammation here in this area is reduced, and there is decreased cell proliferation. In the liver, you get glycogenolysis, an increase in insulin sensitivity, decrease in the insulin growth factor 1 levels. In fat cells, lipolysis and consequent ketogenesis happens. Leptin is the hormone that controls appetite. You get decrease in leptin. So when you are in this state of ketogenesis, you are actually not hungry actually. So I think that is also the basis for, I'm sure you know about the ketogenic diet, where people who wants to reduce weight take in a high fat diet and in an effort to reduce their body weight. And this hormone also involved in lipolysis is increased. So you get enhanced lipolysis, decreased inflammation. In the muscle, there is increase in insulin sensitivity, there is enhanced anabolism, enhanced stress resistance, and you feel cold during the fasting period. So the body temperature is reduced. And in the heart, the parasympathetic tone is increased, the resting heart rate is reduced, somewhat increase in heart rate variability, blood pressure is reduced, and there is also increase in stress resistance. In the brain, there is enhanced network plasticity, increase in neurotrophic factors, neurogenesis. There is mitochondrial biogenesis, i.e. the brain sends signals to the body to produce more mitochondria, decrease in oxidative stress, and decrease in inflammation. So we can put all these together. And of course, from here, we can infer that fasting or caloric restriction can help ameliorate or reduce many of our chronic diseases. Now let's talk.
Professor, your voice.
Yeah. Okay. Is it okay now?
Okay. Okay.
Fasting has been shown to be. I'm trying to reduce this. Okay. Thank you very much. Okay. Fasting has been shown to lower nutrient levels, definitely. So fasting or caloric restriction, where you take in small calories, or the extreme range would be starvation, actually retards or prevent gross reactive oxygen species related damage. Therefore, cellular functions and genomic stability is enhanced. Cancer has been shown in animals to occur later, and the growth is actually smaller. It doesn't progress to malignancy. And lifespan and health span in animal models are increased. So the effects seem to be similar for water-only fasting or alternate day fasting or time-dependent fasting. In humans, there is significant reduction in markers of oxidative stress after time-related fasting, intermittent fasting, or long-term fasting, and also in caloric restriction, whereby the calories is reduced by more than 35%. Now, the pathways involved, I'm just going to go very fast on this, no need for us to know. You know, when we fast or when there is a reduction in calorie intake, the ratio of ATP, which is the energy, to ADP is reduced. And this will cause increase in the ratio of adenosine monophosphate to ATP. And this will activate this pathway, the AMPK pathway, which is adenosine monophosphate protein kinase pathway. And this AMP pathway actually is a stimulant. It will activate other genes as well, amongst which will be the peroxisome, proliferator, activated receptor gamma cofactor 1E here, PGC1 alpha. And this causes increase in production of new mitochondria or mitochondrial biogenesis. Also, AMP affects the sirtuin pathway, which affects the FOXO pathway, which is the Fox-head box protein O, which affects this other gene family, leading to increase in glutathione, which is the antioxidant enzyme present in our body. Also increase in production of antioxidant enzymes such as superoxide dismutase, catalase, glutathione peroxidase, glutathione S-transferase that will counter the effects of reactive oxygen species. There is also increase in autophagy, i.e., dead cells are consumed or damaged cells are consumed by the body, by certain other cells in the body. And eventually what you get is stability of the genome and also lengthened in life or longevity. Now, effects of the thyroid hormone. When we fast, there is a decrease in serum thyroid hormones, and together with a decrease in hypothalamic thyrotropin releasing hormone or TRH, and also decrease in the pituitary thyroid stimulating hormone or TSH, messenger RNA expression, leading to altered conversion of thyroxine in the periphery into the active triiodothyronine. And this is because there is decreased liver deiodinase activity, also impaired clearance of these molecules. Then because thyroid hormones increases lipolysis and gluconeogenesis, the low circulating levels of thyroid hormones during fasting would contribute to reduction of these processes. And with the decrease in thermogenesis, what you get is energy saving, reduced energy expenditure. My experience with the prolonged water fasting was that you feel cold. So you feel cold and you don't really want the air conditioning and you want to take a bath with hot water. Effects on leptin, as we said, leptin is a hormone produced mainly by adipocytes. It regulates energy balance and represses appetite. So fasting will decrease the circulating levels of leptin and also increases the levels of adenopectin. This is the adipokine that stimulates fatty acid breakdown, which contributes to regulation of glucose levels. Autophagy is a process of degradation of abnormal or damaged proteins and organelles. So autophagy is within us to prevent DNA damage. In cancer, it plays quite a controversial role because it can either suppress the tumor or it can promote the tumor, because when autophagy happens, it will provide fuel to a tumor that is already established. So research has shown that fasting or caloric restriction upregulates autophagy, and the mechanisms involved are what we saw before. Yeah. So what you see is there is enhanced immunogenicity of dying cancer cells, and there is immunological cell death. Therefore, fasting enhances the anti-neoplastic properties of chemotherapy, and I'll talk about this later. The fasting or starvation-induced autophagy also increase presentation of cytosolic epitopes and enhance immunization against tumor antigens. Therefore, there is increase in sensitivity towards chemotherapy, i.e. chemosensitization. On the immune system, there is reduction in the number and activity of circulating inflammatory monocytes in both humans and animals. But the acute inflammatory response is affected. In animals, cycles of fasting lessened chemotherapy-caused immunosuppression. So what you see is pro-regenerative effect of fasting on stem cells due to fasting induce insulin growth factor 1 reduction and reduce tumor infiltration of regulatory T cells. So there is lowered adiposity associated inflammation and angiogenic mediators and reduce production of memory tumors in mice. In humans, 30 days of dawn to sunset, time-restricted fasting, which is our Ramadan fasting, resulted in anti-inflammatory serum proteome in healthy human subjects, therefore optimizing the immune function. Lifespan and health span in mouse models is extended, and risk factors for cancer and other age-related pathologies in humans are decreased. If you look at cancer, the expression of many pro-inflammatory cytokines and mediators is increased. This leads to augmented tumor cell proliferation, higher malignancy rate, increased occurrence of metastasis. Generally, the prognosis is poor. Normal cells respond to fasting and a decrease in nutrients by down-regulating proto-oncogene pathways to enter a stress-resistant mode. This protects them from different cancer therapies. But in contrast, cancer cells which have oncogene mutations and activation of these pathways causes them to not be affected by the anti-growth signal produced by fasting. So if you look at the effects of fasting on the longevity of these different models, here is the percent survival, hours of fasting for bacteria, and bacteria is given the medium, and also another group was given the nutrient-free chloride. We see that the one that is not given nutrient has enhanced survival or increased longevity. In yeast, given either the medium or water only, also shows the same effect. In worms, given either the medium or no food, shows similar increase in longevity, and also in mice. In animal models, fasting has a positive effect on longevity, on aging, and on muscle mass. So a combination of alternate day fasting and treadmill exercise in rats causes greater maintenance of muscle mass than intermittent fasting or exercise alone. What is meant by intermittent fasting is fasting for a few days in the week, water only fasting for a few days in the week. When rats were maintained for 10 weeks on a periodic fasting diet, i.e. fasting 3 consecutive days per week, these rats have less hypoglycemia during 2 hours of swimming exercise because they have larger intramuscular stores of glycogen and triglycerides. And it was found that fasting and exercise has similar mechanisms to improve cellular stress adaptation. So several major physiological responses to fasting are similar to those caused by regular aerobic exercise. These include increased insulin sensitivity, cellular stress resistance, reduced resting blood pressure and heart rate, increased heart rate variability as a result of increase in parasympathetic tone. In humans, we know that if we are very consistent, especially during our Ramadan fasting, in not eating too many calories, during sahur, I think there is no problem. But when we break our fast at sunset, during berbuka, we tend to increase our intake of food. We know that people who take in a lot of food has accelerated aging. Therefore, aging is accelerated by glutinous lifestyle, and aging is slowed by energy restriction. The major factors which are implicated in aging include oxidative damage to proteins, DNA and lipids, inflammation, accumulation of dysfunctional proteins and organelles, elevated glucose, insulin, and insulin growth factor 1. In aging, this factor decreases, and when there is severe deficiency, we can see disease. In asthma patients who were maintained on alternate day fasting diet over a period of 2 to 4 weeks, they showed reduced serum markers of oxidative damage and inflammation and reduced clinical symptoms of asthma. Overweight women who are at risk of breast cancer, when fasted for 2 days per week or given a fasting mimicking diet, showed reduced oxidative stress and inflammation. In elderly men, there was reduction in body weight and body fat and improved mood. And the pathways are what we saw before. On the brain, animals maintained on intermittent fasting diet has less neuronal dysfunction and degeneration and fewer clinical symptoms in many models of disease. They also fare better than at limited fat mice, i.e. mice or animals given food whenever they like, they partake of food whenever they like, after acute injury, including severe epileptic seizures, stroke, traumatic brain and spinal cord injuries. Positive effects were also seen in humans. After 3 to 4 months of caloric restriction, there is improved cognitive function in overweight women and in elderly subjects, while subjects or people with mild cognitive impairment who were maintained for 1 month on a low glycemic diet showed improved delayed visual memory, and the cerebrospinal fluid biomarkers for alpha beta metabolism, which is involved in what we call Alzheimer's disease, and brain bioenergetics were also reduced. Metabolic syndrome, we see many cases of this, which is defined as abdominal adiposity, a fat around the stomach area, which is combined with insulin resistance, elevated triglycerides, and or hypertension. And this will increase the risk for cardiovascular diseases, diabetes, stroke, and Alzheimer's disease. So intermittent fasting or calorie restriction or water-only fasting can prevent and reverse all aspects of metabolic syndrome in rodents. So abdominal fat, inflammation, and blood pressure are reduced, insulin sensitivity is increased, and functional capacity of the nervous, neuromuscular, and cardiovascular systems are improved. In humans, periodic fasting can reverse many features of the metabolic syndrome. Insulin sensitivity is increased, there is lipolysis, and reduction in blood pressure. The body fat and blood pressure were reduced, and glucose metabolism was improved in obese subjects who were fasted on alternate days, and overweight subjects who were maintained for 6 months on twice weekly interfasting diet, where they consume only 500 to 600 calories on the fasting days, lost abdominal fat, displayed improved insulin sensitivity, and reduced blood pressure. During Ramadan, the study participants with metabolic syndrome should decrease daily energy intake, definitely, decrease plasma glucose levels, and increase insulin sensitivity. Now, our cells, the normal healthy cells, derive most of its energy from the Krebs cycle via mitochondrial oxidative phosphorylation. Here you can see about 30 or 32 moles of energy, ATP, per glucose is produced by the Krebs cycle, via oxidative phosphorylation in the Krebs cycle, and via glycolysis, only 2 moles of ATP. This is in normal cells. In cancer cells, here, you see that the Warburg effect come into play. Warburg effect is defined as reprogrammed metabolism in cancer cells, where there is increase in glucose uptake. The reason there is increase in glucose uptake is because the cancer cells has about 7 to 15 times more insulin receptors compared to the normal cells. Therefore, When the person with cancer takes in a high caloric, takes in sugar which is converted, or carbohydrates converted into glucose, the cancer cells will preferentially pick up all the glucose first. It will feed first before the healthy cells feed. It will take in a lot of glucose. And this is because the mitochondria in the cancer cell is not efficient. Instead of producing 30 or 32 moles of ATP per molecule of glucose, it's now only able to produce 4 moles of ATP per glucose molecule. So much the energy in cancer cells mostly come from glycolysis, whether this is in the presence of oxygen or not in the presence of oxygen. And this is known as the Warburg effect. Therefore, it is postulated that glycolysis, which is the main source of energy production in cancer cells, can be a potential target to increase effectiveness of cancer therapy. Now, if you look at the signaling pathways, normal cells in mice fasted for 2 days or water-only fasting for 5 days in humans showed increase in insulin growth factor binding protein 1 by about 5 to 10 folds, decrease in insulin growth factor 1 by about 50 folds, and decrease in glucose intake by about 30%. All this has effects on the genes, the oncogenes responsible for growth. So what you see is all these genes responsible for cancer growth, the oncogenes, is suppressed. So the cancer cells are protected, but their growth are not affected. Now, in tumor cells, the same thing happens, but the effect of glucose, of nutrient deprivation or the starvation causes activation of all these pathways. No, I got it wrong. The effect of caloric deprivation causes inhibition of these pathways, which are responsible for cellular growth. So the cancer cells are not able to grow, or there is reduced growth when the person is water fasting or has very little caloric intake. And this is known as differential stress sensitization, i.e. fasting sensitizes the cancer cell, but not the normal cell towards cancer or towards other modalities that causes cell death. We can put all this together if you're interested in the pathway, but I'll leave it to you. The only thing that I want to say is, again, we saw this again, fasting or calorie restriction causes activation of these, and this has effects on the growth of cancer cells. So cancer cell growth is inhibited, apoptosis is enhanced, but normal cells are protected. So again, we summarize, fasting will selectively protect normal cells against toxicants. Here, the toxicant is chemotherapy. So a person who has cancer is normally treated with chemotherapy. And many of the chemotherapy agents work via many mechanisms, some of which is oxidative stress. In a normal person, in a normal cell, chemotherapy causes many adverse side effects. But in the fasted person, or animal model, when chemotherapy is given during fasting, normal cells are protected, but cancer cells has enhanced damage. And this is known as differential stress resistance, i.e. combination of fasting and chemotherapy produces a synergistic effect on cancer cell death, one increasing resistance of normal cells. And we saw what DSS was before. Periodic fasting also causes major sensitization of various cancer cells to chemotherapy, since fasting fosters an extreme environment in combination with the stressful conditions caused by chemotherapy. And we know that cancer cells have many mutations, and many of these mutations are deleterious. Therefore, cancer cells are not very good at adapting to extreme environments. Therefore, in fasting models, when chemotherapy was given, there is increase in cancer-free survival compared to chemotherapy alone or fasting alone, which usually does not cause any cancer-free survival. So many labs have now shown that combination of fasting cycles with chemotherapy is effective, and this effect is consistent at enhancing chemotherapeutic index, and it has high translation potential. So not only chemotherapy is enhanced during fasting, but effects of other toxins is also increased. For example, many cancer patients uses vitamin C has a what they call it complementary therapy. High doses of vitamin C has complementary therapy. And the reason why vitamin C in high doses is able to kill the cancer cells is because the vitamin C undergoes Fenton reaction in the presence of iron to produce hydrogen peroxide, which can kill the cancer cells. Cancer cells are deficient, do not have antioxidant enzymes compared to normal cells. This process does not occur in normal cells, which are able to detoxify the hydrogen peroxide produced via the Fenton reaction. During the fasting stage, the cancer cells are under stress. Therefore, effectiveness of high-dose vitamin C in the cancer cells is enhanced. This is an experiment whereby animals given doxorubicin, rapamycin were also fasted. And here you look at effects on the heart. Doxorubicin is known to cause cardiotoxicity. It also causes hyperglycemia. So here you see that this is ad libitum. Animals were given food anytime they like. This is short-term fasting. These are the animals given free food and doxorubicin. Here, the fasting state with doxorubicin. You see that the increase in diastolic volume that is seen with doxorubicin is reversed in the fasted state. So similarly with the systolic volume and also the with this parameter here, and the histology is here. Yeah. So if you look at the percent survival, animals given doxorubicin only this is the animals given doxorubicin only, okay? If you look at the blood glucose here, here's the ad libitum fed animals. The blood glucose is, when they give DEXA produces hyperglycemia. When given in the fasted state, you see that the survival of these animals is enhanced. This is the survival of animals. They quickly die when they're given free food. When they're given free food with DEXA, here, this is DEXA only. Here is animals free food. When they fasted and given DEXA, the survival of these animals is increased. And rapamycin is another drug which is normally used in chemotherapy. Also causes hyperglycemia. In the fasted state, the hyperglycemia is sort of ameliorated and they have enhanced survival. So cycles of fasting or the fasting mimicking diet enhance efficacy of standard therapies in different types of cancer, including the breast cancer, while there is protection of normal cells from the chemotherapy induced toxicities, And now there is many clinical trials coming on, especially from Professor Longo's lab in Southern California, to confirm safety and efficacy of fasting mimicking diet cycles to improve therapeutic potential of different cancer therapies while decreasing side effects to healthy cells and tissues. Now, people with cancer, once the cancer is not detectable via PET-CT scan, they will still be monitored by the oncologist. Why? Because chances of recurrence is high due to presence of what is known as the cancer stem cells. The cancer stem cells are slow cycling cancer cells. These are characterized by low levels of intracellular reactive oxygen species. So this contribute to self-renewal potential and resistance to chemotherapy or radiotherapy-induced damage to DNA or other macromolecules. They can arise and survive under conditions of hypoxia due to these genes here, due to upregulation of hypoxia-inducible factor HIF1 and upregulation of glucose transporters and glycolysis enzymes such as hexokinase. Thus, the cancer stem cells have metabolic plasticity, thus are able to survive in unfavorable tumor microenvironment. So they are very difficult to kill, and that is the reason why cancer can recur. And I heard that after the recent doses of vaccines, increase in cancer recurrence is very high. But again, this is anecdotal, nothing documented. So I would not go into this. Here is the Kaplan-Meier curve of people with advanced triple negative breast cancer, the most difficult and the most aggressive of the breast cancers, who were treated with first-line platinum-based doublet therapy. A group of the people were maintained on low-calorie diet of less than 100 milligram per deciliter, and here given high normal diet. So you see that the glucose levels were much higher. Here's the number of patients. The survival is higher in people in the patients who given the low-calorie diet compared to the people who were given normal diet. And if you look at here, with time, the number at risk of people given a low-calorie diet is reduced to 1 only. Here, many of them have passed away. And you can look at the multivariate, the hazard ratio here. The mechanisms involved, as we said, we saw this before, but I will skip this. Long-term hyperglycemia is reduced by fasting or usage of fasting mimicking diet cycles. Again, you see progression of free survival in models. This is in animal model treated, given free food, the survival is very low. When given the anti-cancer drug, this is the survival here. The anti-cancer drug was effective in reducing the cancer, but in the fasted state, the progression-free survival is much higher. So here we saw that the causes of death here due to tumor growth is about 70%, and due to hyperglycemia is about 30%. And if you look at the blood glucose levels and compare to the time after treatment, we found that when the blood glucose levels is lower in the people giving the low caloric diet. So the fasting mimicking diet was found to be able to revert late stage triple negative breast cancer progression by potentiating the effect of kinase inhibitors in reversing the lethality caused by hyperglycemia. And tumor volume was measured with number of days of treatment. And at this point here, when samples were taken, you will see that the number of mammospheres formed was smaller in the treated models maintained on fasting mimicking diet, i.e. the low calorie diet. And we can draw this in cartoon form to show the effects of what happens in normal cells versus in cancer cells. So cancer cells on the standard diet causes experience toxicity of these agents. But in the fasting state, the starvation, the pathways essential for cancer cell survival is reduced. So there is reduced number and stimulus of cancer cells. Thus, fasting mimicking diet reverts late stage triple negative breast cancer progression by again the same similar summary that we said before, by potentiating the effect of kinase inhibitors and reversing lethality caused by hyperglycemia. This is a multi-center matched case control study which compared dietary intakes of 973 patients with breast cancer compared to high calorie controls. People who take the normal diet was given, this is premenopausal woman and this is postmenopausal woman. For all women, the caloric index is 1. So this is the baseline for people who take normal diet. When caloric intake is reduced to below 20%, you see that there is fraction overall in all women, in premenopausal woman, in postmenopausal woman. When the diet is high in calories, there is no protection. Overall, in premenopausal and postmenopausal women. Thus, high calorie intake increase the cancer risk for all hormone receptor positive tumors, while caloric restriction of more than 20% below predicted value resulted in protective effect. There are reports coming in that says that when a patient with cancer undergoes chemotherapy and who are also fasting before the chemotherapy, during the chemotherapy, and after the chemotherapy, they experience less side effects compared to the non-fasted patients. So you see that here, these are the different side effects. Fatigue is reduced. Black is people who take normal food. This is fasted state. Fatigue is reduced. Weakness is reduced. Hair loss, alopecia is not affected. Headache is not affected. Nausea, vomiting is somewhat reduced. Vomiting is actually reduced. Diarrhea, the other factors are not also reduced actually. So many of the papers says that people who are fasted while undergoing chemotherapy has less side effects compared to the chemotherapeutic drugs compared to the people who eat normal diet. But here's another randomized control trial. This is HER2 negative breast cancer patients who are fasted 24 hours before and after chemotherapy, or they just eat according to guidelines for healthy nutrition. And this is the cycles, the days after chemotherapy You look at the erythrocyte count, also the thrombocyte. This is the fasted people, non-fasted. So fasting actually protects reduction in erythrocytes, also the reduction in thrombocytes due to chemotherapy. DNA damage is also reduced in the fasted group. I'll leave this busy slide and show you another slide later. This is a randomized crossover pilot study that looks at the effect of fasting during chemotherapy on quality of life. And the summary was, fasting was well tolerated, quality of life and fatigue during chemotherapy was improved. And here, another trial looks at the effects of pre-chemotherapy fasting, consuming calories of less than 200 kilocalories for 24, 48, 72 hours in cancer patients given platinum-based combination chemotherapy without radiation. Serum levels of IGF, insulin growth factor binding protein 1, insulin and glucose did not change after 2 cycles. The fasting during chemotherapy was found to be safe and feasible. Toxicity was mild, limited mostly to fatigue, headache, dizziness. DNA damage is reduced. The method to measure DNA damage was common assay. This is fasting for 24 hours, 48 hours, and 72 hours. And this is the baseline. So we see that DNA damage is reduced. The parameters measured in people who were fasted. So summary, our sedentary lifestyle, or if we eat at night, and now we know that, look at the younger generation, they come back late and they eat late at night, especially in Malaysia. Genetics, also because of food marketing, so we tend to eat a lot, or our social life, and also shift work, predisposes us towards obesity. And you see increase in all these parameters, body weight, fasting glucose, there is increased fat accumulation, insulin resistance, increase in cholesterol, triglyceride levels, increase in blood pressure, the cardiac health is not so good, aging biomarkers are also increased. While fasting or calorie restriction will reverse all these parameters. So many reports show effectiveness of fasting in amelioration or reduction of all these parameters. And now reports from human studies are coming out as well. That 40-day fasting, 40 days of water only fasting is able to reduce many of these. Of course, definitely your visceral fat will go down. Visceral fat will go down, body weight will go down. This will definitely go down, and this will be enhanced. Insulin resistance will go down, so the cells are more sensitive towards insulin now. This gets normalized. This gets normalized. This is better, and this gets reduced, i.e. there is improvement in aging and longevity, increase in longevity. During cancer, if you have cancer, fasting before, during, and after chemotherapy actually enhances the work of the chemotherapeutic agents, but also protects normal cells against the adverse effects of chemotherapy. And that is very promising for cancer patients. I thank you for your attention. Thank you for your attention.
Thank you, Professor Aisha, for your presentation. And now we move to the question and answer session. There are 2 questions for you, Professor Aisha. First is, it is interesting to know that many benefits from fasting from the health as sorry, I have to move this one first. As Rasulullah said, and I think it's something happened with my computer. Is there any finding about the negative effect from fasting so far, Professor? So we already have the benefit, but is there any negative effect for that?
When we talk about Ramadan fasting, there is no negative effects. Actually, it has beneficial effects, provided we do not overeat during our breaking of the fast. And I know that in our Malay culture here, because it is a special month. So when you break fast, you normally break at a masjid or surau, and there is always a feast. Even at home, we always have a feast.
Yes.
So we tend to overeat. But if you restrict the amount of food you take, or you take a reasonable amount of foods during what do you call it, during sahur, and also at breakfast, you get many other beneficial effects of fasting. But to get the best effects, and from the reading and my own experience, I recommend water only fasting. Water only fasting. And I said before, I did water only fasting for 40 days. And the maximum number of days tolerated by humans that has documented is about 60 days. The negative effects will be if you take it too far. If you do water only fasting, like you don't eat anything maybe for 70 days or maybe 90 days, definitely you will now go into starvation. But if you were to undertake prolonged fasting like that, during the fasting you'll be okay, but when you break the fast, many imbalances can happen. So the breaking of the fast is very important. So what is recommended is, and I take a lot of green juice. When you break the fast, for every 5 days of water only fasting, you break the fast with green juice. You cannot immediately makan nasi. Take a heavy meal, cannot. That will kill you. So you have to ease yourself into the fasting, into the normal mode.
Okay. Thank you for your answer, Professor. And the other question is, Professor from Yustiani, Professor Aisha, how long do the intermittent fasting health benefits last in our body? Should we perform it regularly outside the Ramadan fasting, as in Monday, Tuesday, or Daud fasting? Which one?
Nabi Daud fasting is very effective. Also, Monday, Thursday fasting has proposed by Rasulullah SAW. Or if you want to do water fasting, maybe you do 5 days per month. 5 days per month. And I guarantee you, for people who are overweight, who has high visceral fat, that will really reduce it. You will have a flat stomach and you will look younger, much younger. Plus, if you have any chronic diseases, that will totally be reduced.
Okay. Okay, so it's the best one, right?
The best one is what has been proposed by Rasulullah. But the best one is the Sunnah from our Nabi.
Okay, it's very interesting one. Actually, I think we presentation reveal that how much the how benefit the fasting for our body. It's not only for the quality of life, but also related to the disease, right? Related to this fasting. So how about if we are like a diabetes, so what is your recommendation for related to this fasting behavior?
If we do not eat excessively, we do Nabi Daud fasting, or we do Monday, Thursday, plus Puasa Putih, the 3 days a month. But fasting, that will be good. Or if you want to reduce the blood glucose, because if you want to do water only fasting, you cannot just go straight into it, especially if you're used to taking carbohydrates including nasi, rice, and sugar. So you have to ease into it. So the recommendation is for 2 weeks before you start your water fasting, don't take any carbohydrate.
Oh.
The best thing, the easiest to do is not to take any sugar. Don't take any sugar in your food, in your drinks. And then don't take any kueh, any flour-based products. Don't take any rice. Take a lot of vegetables, especially the raw vegetables.
Lapar nih.
Okay.
Iyo, mau yang tadi dak kate kulo lapar nih.
Committee could
Ellie.
help us to mute for the participant.
Okay.
Okay. Okay. So that is the key for the diabetes also. So actually,
Yeah, reduce carbohydrate or don't take carbohydrate. You will find that your diabetes will come down. You will look younger. You'll be very slim. You don't have the problems.
Okay, that's good.
But that is difficult. To lawan nafsu is very difficult.
Yeah, that's difficult. Like in Ramadan, if you breakfasting and then so many kue and so many sweet,
very hard.
We cannot
Cannot tahan.
to stop ya, nggak tahan.
That's
ya.
right.
Okay, Professor Aisyah, it's a very nice presentation, and of course it closely related to our religious practice, yeah, related to
Yes.
fasting.
Thank you.
So now it's time for us to express our appreciation to you by giving certificate for
Thank you.
you.
Thank you.
Okay. Okay. This is the certificate from on the behalf of conference committee. This is a certificate of appreciation for your
Thank you.
contribution as a speaker in our conference. Thank you
Thank
very
you.
much, Professor
Thank you.
Aisyah.
Thank you.
Okay. Thank you.
Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh. Well, of course, it's the three speakers already delivered the presentation with a very nice and very knowledge. Yeah, it's broaden our knowledge about this issue. So thank you for all speakers for your contribution for our conference today, for your great presentation. Our three amazing speakers already share a lot of insight about how important to build a global partnership among us. And from the speaker, also we can conclude that building partnership is sometimes challenging, but we need to do that to achieve the same goal, which is health for all. So we also need to consider the contribution of religious practice, such as fasting, for the quality of health. So I want to say thanks also for the all participants that stay and join in this session. We are now in the end of morning plenary session. Let me do apologize if there's any inconvenience during this morning session. And please allow me to close the session. And for participant, don't forget to join again after the break for the afternoon plenary session. See you again after the break. Please enjoy. Thank you very much for your time, and I give it back to the Master of Ceremony, Dinda and Irzan.
Okay, thank you very much to Mrs. Narila Mutia Nasir, PhD, for leading the plenary session with three amazing speakers. And now we would like to give a certificate for Mrs. Narila Mutia Nasir, PhD, as a moderator for today. So here it is, the certificate.
Thank
so here it is, the
you.
certificate. Thank you very much, Mrs. Narila Mutia Nasir,
Thank
for being a
you.
very amazing and great moderator for this plenary session.
Thank you. See you.
We also would like to thank all speakers and participants for your attention and participation in these first plenary sessions. We hope the knowledge shared and the discussion held will give benefit to all of us in developing the field of health in the future.
We will have a break time, but before that, I would like to remind all the participants to fill in the attendance sheet that was shared in the Zoom chat box, and we will still continue our plenary session after the break. So please don't forget to join again.
We expect all participants to be in the main room by 1 p.m. as the moderator will begin punctually. Until then, we will have a break for about 1 hour. Please use this time to refresh your mind so that by 1 p.m. you will be in your prime condition. Have a nice break.
Dek, bangun Dek. Tidurnya di mana? Kok di sini?
Ampar-ampar pisang, pisangku belum masak. Masak sabigi dihurung bari-bari. Masak sabigi dihurung bari-bari. Mangga lepok, patah kayu bengkok. Bengkok dimakan api,
Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta merupakan hasil transformasi dari Fakultas Kedokteran dan Ilmu Kesehatan yang tujuannya bukan hanya menjawab kebutuhan zaman, tapi juga langkah strategis mempersiapkan tenaga kesehatan yang handal dan profesional. Fakultas Ilmu Kesehatan resmi berdiri setelah terbitnya Peraturan Menteri Agama RI Nomor 1 Tahun 2018 tanggal 15 Januari 2018 tentang perubahan statuta UIN Syarif Hidayatullah Jakarta dan diimplementasikan oleh Rektor melalui SK Nomor 141A Tahun 2018. Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta mempunyai keunggulan dalam mengintegrasikan ilmu kesehatan dan keislaman. Progresivitas tersebut tidak terlepas dari kemajuan teknologi yang secara alami merubah cara pandang dan pola hidup di masyarakat. Oleh karena itu, hadirnya FoHS UIN Jakarta diharapkan dapat memperkuat pembangunan kesehatan yang berwawasan keislaman. Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta memiliki 5 program studi, 3 program studi tingkat sarjana, dan 2 program studi profesi. Kelima program studi tersebut sudah diakreditasi oleh LAMPTKes sehingga membuat Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta sejajar dengan universitas besar lainnya di Indonesia. 5 program studi di Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta adalah Program Studi Farmasi. Program studi farmasi mengaplikasikan nilai-nilai keislaman dalam pengembangan ilmu kefarmasian dalam rangka membuat dan menghasilkan produk kefarmasian yang bermanfaat untuk masyarakat dengan memperhatikan status kehalalan dan ketoyiban. Peluang karir lulusan prodi farmasi antara lain tenaga ahli farmasi di rumah sakit, lembaga pemerintah, industri obat, kosmetik, alat kesehatan, apotek, wira swasta, distribusi obat, peneliti, tenaga pendidik atau dosen, dan tenaga ahli kehalalan obat. Program studi kesehatan masyarakat. Program studi kesehatan masyarakat mengkombinasikan dan mengedepankan nilai-nilai keislaman dan kesehatan yang ada dan berkembang di masyarakat. Lulusan prodi kesehatan masyarakat yang berintegritas dapat berkarir di pemerintah, perusahaan, rumah sakit, tenaga pendidik, klinik, dan tenaga kesehatan lainnya. Program studi keperawatan dan program studi profesi nurse. Sebagai salah satu program studi dengan akreditasi A, program studi keperawatan dan profesi nurse menyelenggarakan pendidikan yang terintegrasi antara nilai-nilai keislaman dan keperawatan sehingga menghasilkan lulusan yang kompetitif, berkualitas, dan religius. Lulusan program studi keperawatan dan profesi nurse berpeluang besar untuk menjadi nursing trainer, perawat profesional, peneliti, dosen, dan entrepreneur di bidang keperawatan dan kesehatan. Program studi profesi apoteker. Program studi profesi apoteker menghasilkan lulusan unggul yang dapat mengaplikasikan nilai keislaman dalam ilmu kefarmasian dan kemasyarakatan secara komprehensif sebagai ciri khas dari program profesi apoteker UIN Syarif Hidayatullah Jakarta. Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta memiliki tenaga pengajar yang secara akademik sangat berpengalaman dan memenuhi kualifikasi di bidangnya. Mayoritas tenaga pengajar sudah menyelesaikan program doktor yang merupakan lulusan universitas terbaik di tanah air dan lulusan universitas luar negeri dengan berbagai spesifikasi ilmu kesehatan yang dibutuhkan. Tenaga pengajar Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta juga aktif menulis dan menghasilkan karya ilmiah yang mayoritas sudah terindeks pada jurnal bereputasi internasional. Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta berkontribusi aktif pada beragam program atau kegiatan sosial dan pengabdian masyarakat untuk mengimplementasikan value yang terpatri dalam Tridharma perguruan tinggi. Di era pandemi COVID-19, peran Fakultas Ilmu Kesehatan semakin nyata. Beberapa contoh adalah program dosen dan mahasiswa untuk menjadi relawan pencegahan dan penanganan COVID-19, membuat hand sanitizer untuk seluruh sivitas akademik UIN Syarif Hidayatullah Jakarta dan masyarakat sekitar, membantu korban bencana alam, donor darah, penanggulangan stunting, terlibat aktif pada program gerakan masyarakat hidup sehat di 5 provinsi di Indonesia, Sistem pendidikan yang berkualitas dan terintegrasi berdampak positif kepada capaian prestasi yang didapat oleh sivitas akademik Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta di tingkat lokal, nasional, maupun internasional. Dalam rangka meningkatkan mutu program pendidikan dan pelatihan, Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta telah banyak menjalin kerjasama dengan rumah sakit, perusahaan farmasi, Dinas Kesehatan di berbagai daerah, Kementerian Kesehatan, serta beberapa universitas di luar negeri seperti Griffith University Australia, Jose University Jepang, dan beberapa universitas luar negeri lainnya yang telah membangun kerjasama dengan Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta.
Lahirnya Fakultas Ilmu Kesehatan memberikan warna baru dalam potret pendidikan Islam modern di Indonesia. Kehadiran Fakultas Ilmu Kesehatan diharapkan dapat menjadi ujung tombak untuk mewujudkan sumber daya manusia yang sehat, rohani, dan unggul pemikirannya. Dengan demikian, Fakultas Ilmu Kesehatan harus terus-menerus meningkatkan kualitas dan memperkuat kerjasama dengan berbagai pihak yang menopang keberlangsungan proses akademis di Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta.
Tidak ada peluru ajaib untuk mengakhiri masa pandemi. Masalah dan tantangan yang semakin kompleks tidak mungkin diselesaikan dengan cara biasa. Perlu pengorbanan, dedikasi, dan percepatan dalam dunia pendidikan kesehatan. Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta terus menguatkan perannya bersama dengan pemerintah dan seluruh elemen bangsa untuk mewujudkan dan membangun Indonesia sehat di masa depan. Peningkatan mutu pendidikan terus dilakukan demi tercapainya kompetensi lulusan yang sesuai dengan tuntutan zaman. Dengan prediksi bahwa Indonesia akan mengalami masa bonus demografi ke depan, Fakultas Ilmu Kesehatan akan terus melahirkan apoteker muslim, perawat muslim, dan sarjana kesehatan masyarakat muslim dengan kompetensi sesuai tuntutan global.
Bagi saya, Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta adalah bentuk pendidikan transformatif, integratif, dan inovatif yang dapat menunjang pengembangan aspek kognitif, afektif, dan psikomotorik mahasiswa, baik di bidang akademis maupun non-akademis.
Saya bangga dan bersyukur telah diberikan kesempatan mengenyam pendidikan di Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta. Sebab banyak hal yang saya dapatkan selain dibentuk dan dididik untuk menjadi praktisi kesehatan yang caring dan profesional dengan mengintegrasikan nilai keislaman sebagai dasar dan pedoman dalam mengimplementasikan ilmu kesehatan di dunia luar.
Saat ini, saya sebagai mahasiswa S3 di Departemen Diagnostic Radiology and Nuclear Medicine, Gunma University, Japan. Alhamdulillah wa syukurillah, banyak sekali ilmu dasar kefarmasian yang saya peroleh berkat bimbingan para dosen di Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah, Jakarta. Selain itu, dukungan serta doa yang diberikan kepada saya memotivasi saya untuk terus mengembangkan keilmuan, terutama radiofarmasi, agar dapat berkontribusi dalam bidang pendidikan dan penelitian.
Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta sebagai penyelenggara dan pelaksana pendidikan bermutu dalam mentransfer ilmu-ilmu kesehatan yang dilandasi nilai-nilai Islam sebagai karakteristik pendidikan Islam terpadu untuk mencetak tenaga dan ahli kesehatan yang mampu untuk terus berinovasi sehingga dapat menjadi pendongkrak kemajuan bangsa dan negara.
sulit kumandang suarane, tulang tulit kepena unine. Unine mong renyoake bareng lan kentrong ke tipong sulit segera kendangane. Kandang sulit kumandang suarane, tulang tulit kepena unine. Unine mong renyoake bareng lan kentrong ke tipong suling segera kendangane. Kandang sulit kumandang suarane, tulang tulit kepena unine. Unine
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. We cordially welcome you back to the plenary session of Second International Conference on Health Sciences that held by Faculty of Health Sciences UIN Syarif Hidayatullah Jakarta. Ladies and gentlemen, we would like to introduce the moderator for our second plenary session, Mr. Muhammad Iqbal Nurmansyah, Master of Science.
We will first read a brief introduction about our moderators today. His full name is Muhammad Iqbal Nurmansyah. He was graduated with the title Master of Science from Public Health Department, Dokuz Eylül University in Turkey. He is a lecturer at undergraduate program of Public Health, UIN Syarif Hidayatullah Jakarta from 2019 until now. He has published more than 25 publications, include international journal. Without any further ado, we invite Mr. Muhammad Iqbal, Master of Science, to take over the plenary sessions. To the Honorable Mr. Iqbal, the time is yours.
Okay, thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. I'm Iqbal. Will be serving as a moderator in this session, and welcome to the International Conference on Health Sciences 2022. The respected honorable leaders of UIN Syarif Hidayatullah Jakarta, leaders of Faculty of Health Sciences, UIN Syarif Hidayatullah Jakarta, our invited speakers, guest speakers, and also all of the participants of the International Conference on Health Sciences 2022. And in this session, we will hear a presentation from Professor Nurdeng, and I think Professor Nurdeng has been already here with us in the Zoom meeting. Assalamualaikum, Prof. Nurdeng.
Waalaikumsalam warahmatullahi wabarakatuh from Brunei Darussalam.
I think you can speak bahasa Indonesia.
Yeah, I can speak bahasa Indonesia, English, as well as Arabic and Thai, full language.
Yeah, it's amazing. Okay, before we will hear a presentation from Professor Nurdeng, I would like to introduce Professor Nurdeng in brief. Can operator show the brief profile of Professor Nurdeng? So we will discussing the topic is related to preventive and disease prevention and health promotion program from the perspective of Islam. And this is very interesting topic and also important topic, because I have read one article that stated that no matter how much money we spend for health programs, it will be insufficient if we don't implement the disease prevention program or health promotion program. And also from the other perspective, there is also a famous, it's like idiom, prevention is better than cure. So it's very important topic, and we will hear from Professor Nurdeng about this topic. But I would like to read the profile of Professor Nurdeng. Sorry. So currently he is serving as a founder and the first director or dean of Halalan Thayyiban Research Center, University Islam Sultan Syarif Ali Unisa Brunei Darussalam. And previously he was also serving as a head of laboratory of Halal Policy and Management, Halal Products Research Institute, University Putra Malaysia. And also he also joined Imam Bukhari Research Scholar or fellow at the Oxford Center for Islamic Studies, Oxford University in 2004. And also visiting professor Walailak University in 2012. He obtained Bachelor of Art from the International Islamic University Malaysia, and his Master of Art and also PhD from the International Institute of Islamic Thought and Civilization. All right, let us hear from Professor Nurdeng about this topic. Professor Nurdeng, the time is yours.
Okay, thank you very much, Mr. Moderator. So allow me to share my slide for these presentations. Have you seen my slide? Have you seen my slide?
Not yet, Prof. It's still loading.
Not yet? Okay, okay. How about this?
Yeah, we can see it.
Okay, thank you very much, Mr. Moderator, Muhammad Iqbal, Nur Mansyah, and I would like also to thanks to the directors, as well as the chairmen of the organizing committee, the second international conference on Halal Science 2022, as well as all the committee members who work hard in order to materialize today's events. I would like also to address to all speakers who participates and sharing their idea and opinions in these events, and so no doubt to all the students of UIN Syarif Hidayatullah State Islamic University, and ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. And so very good afternoon from Negara Brunei Darussalam. And at the present in my office in Negara Brunei Darussalam. So Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Okay, today I would like to talk something related to Islamic medical traditions. We'll focus about the prevention aspect, the treatment of disease management aspect, which has been practiced from the time of the Prophet Muhammad sallallahu alaihi wasallam until what we call especially during the golden period of Islamic civilizations during Abbasid dynasty, and continue until today, even though not as before. And Alhamdulillah, I lucky when I was a student in International Institute of Islamic Thought and Civilizations. I come across with the Islamic medicines through Professor Dr. Sami Khala Hamarneh, as well as others, who is the only great scholars of Islamic medical history, philosophy, and as well as the ethics. So that is why today, even though my slide is almost 70 slides, I know that so much a slide, but I try to what we call highlight every idea that being written in my slide in a fast manner, as well as with a brief explanations. Ladies and gentlemen, I'm very happy to be with you today, because actually this is my expertise from during my study as MA students as well as PhD, since I wrote what we call the thesis related to medical ethics, medical philosophy, and medical history, especially from Al-Biruni as well as other great Muslim scholar perspective, including also the Sharia perspective. So that is why the title of my presentation today, I give very general one, the ideas of prevention and treatment of disease management in Islamic medical traditions. So now, under this topic, I divide into several subtopics, including also the background that you have to know about what we call Islamic medical medicines, because we know that Islamic medicine, when we talk about Islamic medicines or the prophetic medicine, is mostly we talk about the history in the past. We cannot compare the progress as well as the developments of today or modern medical arts, since the methodology is also a little bit a difference. However, we understand that the previous knowledge have to be the basis or the foundations of modern civilizations or modern medical arts. That is why I'm very happy with what has been said by what we call the by Wellcome Institute of the History of Medicine in London, saying that The medicine today is a result of yesterday research. Right? Today research will produce tomorrow medicines. So meaning that what has been found today as a result of the previous contributions. So therefore, you have to look positive aspect what has been understood by the people in the past, including also, for example, about the first slide, what is health and disease. Even though it's simple term, but it's not so easy to understand. However, according to Al-Mu'alajat Al-Ibuqratiyah, Ibuqratiyah refer to the Hippocrates. Hippocrates is among the founder of medical science in Greek civilizations, and the book has been translated into Arabic during the golden period of Islamic civilizations. So, including also, you can find these definitions given by At-Tabari. Tabari, who died in 986 of Christian era, meaning that 1,000 years ago, they are already concerned about the meaning of health and disease. They contribute a lot about in this discipline. No doubt, we will ask you, are you okay? Are you in good conditions? If you say that good condition, it means that it is considered to be in a normal state, to be in sound and natural functions of the healthy. Healthy in terms of your organs, including also healthy and balance of your temperaments. Why disease is the outcome of the partial or total malfunctions. So now you may ask yourself whether you are really good health as defined by the has been defined by At-Tabari or by Hippocrates or otherwise. I know that maybe all of us are good health, maybe 90% and 10% we have also a problem with our eyes, with our tongues, with our heart, with our mind, sometimes also with our physical conditions that sometimes we feel hot, we feel not good and so on. However, to have a perfect, what we call health, of course, everything must be perfect, including also what we call temperaments. Temperament refer to the balance between cold and hot, between dry and wet. So we try to define the definitions in according what has been defined in the past. Therefore, when we study about the prevention, treatment of disease, in line with these definitions. Maybe according to World Health Organization, there are another definitions. Okay, now we come to the technical term, food or diet, drug and poisons. This is very important that we have to understand. Because why? Once we understand this, we will know what is the origin of disease which has been understood in the past. In the past, meaning that in the time of the Islamic civilizations. So I put the word here, diet, because in Arabic we have two terms. The term at-ta'am mean food. The term al-ghaza mean diet. Sometimes we understand that diet meaning that you eat little. But actually the meaning diet here refer to the term al-ghaza means adapt to the power and functions of the body, digested and assimilated to replace what energy has been lost. Thus, diet first affect body, meaning that if you consume the food, let me say that the rice, nasi kato, or what we call nasi ayam and nasi biryani and so on, if, for example, 90% of that food has been digested completely, has been used, and in order to replace what has been lost, so meaning that that part of your food can be considered as the diet or what we call al-ghaza. The rest may be not difficult, become maybe poisons or become maybe not harmful and so on, right? So in this case, when the prophet or the traditions or what we call the words which has been written by the scholars in the past mention the word diet or mention the word al-ghaza in Arabic, it means in this manner. When we come to the drug, fall between the diet and poisons, right? Of course, the diets, you understand, the poisons, meaning that act of forcibly on the body's functions, causing sickness, something which cause you not imbalance and sick, or sometimes go maybe because of that you die. So because of what we call the poison. So in this case, let me say that the virus, coronavirus that we have today, under the category of poisons or under the category of drug or under the category of diet? I'm sure all of you will answer that under the category of poisons. But sometimes because of technology, we may use the poisons, we may use, for example, the coronavirus as the diet in order to attack the poisons. Because we understand that sometimes to find the drug, we have to find something from the origins of the disease. For example, in the case of what we call, we have several vaccine today, and some of the vaccines, they try to use what we call the coronavirus in order to kill or in order to prevent the another coronavirus, become the enemy. In another word, one become the hero, another one become what we call enemy. Once the enemy or the hero come in order to attack the enemy maybe die, or if not, maybe enemy will not active anymore. This is what we call the concept of modern technology today that we have. Okay, now the word active, or what we call the word medicine, also very interesting when we look what has been defined by Ar-Razi, Abu Bakar Muhammad Ibn Zakaria Ar-Razi, who wrote several books, including also Al-Hawi fi At-Tib. He considered medicine as the art concerned with the preservation of healthy body, the prevention of disease, and the restorations of the sick back to the health. So we have to keep in our mind that as far as Islamic medical traditions or practice is concerned, we are concerned about prevention and preservations, and of course, the restorations of the treatment of the disease. But today, when we talk about medicines, we look to the grand hospital, by which become the center of the treatment, and less contribute to the center of the prevention or preservation. This is maybe a different concept. Therefore, nowadays, sometimes we are proud with the big hospital, with the thousands of beds, and actually meaning that we have a lot of disease, or in another word, our money spends for the treatment of the disease rather than for the preservations and for the preventions. But in Islamic medical traditions, if we go to almost every what we call literatures, medical literatures, which has been written in the past, they are very concerned about the preventions, as highlighted by the moderator at the very beginning. This is in lines with the different definitions of medicines. You will see the word medicines from the word tibbu. Sometimes with tibbu, we say that tabib means medical doctor, but sometimes we call it as the physicians. Which one is the most correct one? This is also one of the questions. However, in the past, we call what we call tabib as the physicians rather than as a medical doctor. Why? Because physicians come from the word physics, come from the word tabi'at. So physics means something that you know physically or related to the natural science. So no doubt what we call ilmu perubatan or medical science is part of the natural science also. Therefore, they sometimes call as a physician, refer to physics, which the word physics also has the origins from the Latins, which related also to the natural science. Okay, the origin of disease. This is very, very interesting. If you ask the medical doctor today, and with due respect, and respect to all medical doctors, even though we have a different in terms of what we call understanding, but actually, if we try to understand in a comprehensive manner, There is no difference, in fact. There is no difference. You will find, for example, the hadith of the Prophet Muhammad SAW, which mention about the disease, which mention about the healing, they are contradict between one to another. However, if we understand and interpret the hadith, we will see that one statement, one hadith complement between one to another or support between one to another rather than to say contradict in terms of the opinion or idea or in terms of the concept. Right. So I know that when we go to the medical hospital, when you say that you are sick, they will say that, oh, because of because of virus, because of bacteria, and because of something that can be what we call seen in the laboratory. However, when we look to the tradition of the Prophet, right, this is not my saying, my traditions. I just refer to what has been said by the Prophet. The stomach is the house of the disease, right? The stomach is, well, of course, that means the perut, right? The perut. Why the stomach is the storehouse of the disease? What do you mean that the stomach here refer to the stomach physically, but actually refer to the food here? Because the stomach is the place where the foods for the first period will stay there for at least maybe 5 hours before digest and process to another part of our body. But when we say that the stomach here, meaning that the food, and the food, we understand that the food, if for example become diet, that is not the origins of the disease. The food that are not able to be digested, to be processed, but still stuck in your intestines or stuck in your body, that is the problem. Maybe can be called as the poisons, can generate what we call bacteria, virus, and so on. That is what we mean the stomach is the house of the disease. However, there is another interpretation about this thing. Again, as I mentioned to you, sometimes when we look to the first hadith saying that food is the origin of the disease. However, there is another tradition saying that al-himyah ra'su ad-dawa. Al-himyah ra'su ad-dawa. Dieting is the main medicines, right? Diet. So diet here, we already defined the meaning of diet, not as we understood today, saying that if you eat little, this is a diet. Okay, maybe also there is the sense, there is the connections of your understanding today with what has been said by the Ibn Khaldun long time ago. He tried to say that the dieting here, meaning that going hungry. So meaning that there is the space for the stomach, for your instinct to process. If, for example, you are in full, you are always in full, that is what we call not good condition already. It will create some problem. But however, if, for example, you are fasting and break fasting, or in another word, you have one third is water, one third is air, one third is food. So this concept, what we call going hungry. So not what we call in all situations you are in full. So make difficult for your instinct and perut or stomach to process in this case. So this one also one of the understanding about the concept al-himyah ra'su ad-dawa. Sometimes al-himyah we translate into English as prevention, but here what we call Ibn Khaldun interpret as dieting, or what we call going hungry. Very significant. Does not mean that the meaning going hungry with the diet or what we call with the preservation or prevention different in between one to another. No, actually there is integration, complement between one to another in order to have very good understanding about the medical aspect of something. The next statements, al-aslu adda al-barada. The origins of every disease is al-barada. Al-barada is in Arabic, which stated in many medical literature in the past. Barada sometimes we can be understood as buruda, mean cool. Cool. The buruda means the opposite of harara. Harara means hot or heat. But here we translate the word al-baradah as indigestions. So if you have food and then you consume with your mouth, go to your stomach and go to your intestine, some part of your food are not able to digest, that is what we call the origins of every disease. So does not contradict with the first tradition that I recite to you, Al-Ma'idatu Baitul Adha, right? So the interpretation of baradah here is indigestions. Of course, this is one of the translation. Maybe the another scholars will translate as cool, as cool. Why the meaning of cool? Because once, for example, your stomach is too cool, your condition is too cool, that means you do not have enough power, enough energy in order to process food. Once you do not able to process all food because of less energy, less of heat, or what we call heat become the energy, right? So therefore, the food also may stuck in your intestine, or maybe in your al-ma'idah, or maybe in certain part of the organs, and finally becomes the problem in your health conditions. Okay, another hadith, when we talk about the origins, right? Another hadith saying that illness originate from the fever, and most illness are fever. We understand that. Why, for example, what is the symptoms of the COVID-19? One of the very well-known symptoms is a fever. Doctor said that if you had a fever or coughing, please do not come and visit our health center, right? Especially at the early of spreading of COVID-19 in these regions. Why? Because of fever, right? Because of your temperature may be a little bit high. But the hadith said that what we call the hadith said that fever also the origin of disease. Sometimes you say the contradict with al-ma'datu baitu adha. That means the stomach is the storehouse of the disease. In fact, there is no contradictions. That is why when we refer to Ibn Khaldun interpretations, he said that now illness originate from fevers, and most illness are fever. We found that every disease that we have, even for example, you have, for example, COVID-19, or maybe H1N1, or maybe coughing, there is something related to the fever. Therefore, the doctor sometimes will give to you what we call antibiotic, and at the same time also will give to you the what we call apa, ubat yang kata untuk demam tu, right? So because every fever, but the reasons why fever is become the what we call the reasons behind the disease, that and harmony with the hadith that I mentioned before. They say that the natural heat, when you are fever, the natural heat is too weak to complete the process of boiling in each of those stages, meaning that are not able to process the food properly. So meaning that again related to the origin of disease as because of food and so on. So therefore, the nourishment does is not fully assimilated. So this is in regard to the origins of the disease. Okay, I try to move the next slide, but okay. Now we come to the prophetic medicines, right? We know that the prophet's life is very simple. There is no hospital as we had before. Because why? Maybe according to what we call the report saying that when the Persian government sends a medical doctor to the Medina in order to treat the companions, and finally less of the companions come and visit the medical doctor at that time, and then so the physician complained to the prophet, and the prophet said that my ummah is what we call 1/3 of my ummah or my companions consume only 1/3 of food, 1/3 of water, and 1/3 of air, something like that. And finally, there is in good conditions, no need to, less of them have what we call difficulties in terms of treatment. There is no chemical use during that time that we have today. There is no car that we have to smoke carbon here and there, and poison here and there, because so not such thing happened during that time. So therefore, what we call the people are mostly what we call is healthy and safety. However, when we have to refer to medical tradition, no doubt we have to understand at the very beginning, the hadith that related to medicine just merely collection here and there. In the time of Khulafa al-Rashidin, also the same thing. And so at the time of Umayyah, Khalid Umar ibn Khattab ibn Abdul Aziz, also just ordered to collect hadith seriously. And then some of the companions and then some of the Muslim scholars also tried to collect as well as to classify the hadith in according to the subject matter, including also subject that related to the medicines. So we have several Muslim scholars who collect the hadith and then classify according to the subject matter, including also subject that related to medicine. For example, Imam Bukhari, who died in 870 Masihi. So as I mentioned by the moderator, that I was appointed as Imam Bukhari scholar in the Oxford Center for Islamic Studies in 2004. Therefore, during that time, I studied the book of medicines of Imam Bukhari, and then Alhamdulillah, I published that. So I found that in Sahih Bukhari, the book of medicines, what we call, we have 58 chapters with 104 traditions that related to medical arts. So when I look to this hadith, I also try to arrange. I found that 3 aspects has been discussed, has been mentioned: treatment of disease and prevention and preservation. Right. So that is why today I'm going to talk what we call aspect of prevention, aspect of healings or treatments, as well as maybe the theories or the finding which has been found by the Muslim scholars during the golden period of Islamic civilizations. This is to say the importance of the medicine of the Prophet. We found that Khatib Shalabi, right, also very well-known Muslim scholars from Turkey, who tried to list down the book that related to the prophetic medicines, and found several scholars, including also Sayuti, including also Abu Nuaim, including also Al-Isfahani, and so on. But some of their books are available, some of their books already lost, not available in the library. And Manfred Ullmann, for example, this is one of the very Orientalist scholars, also very concerned about Islamic and prophetic medicine. I'm sure if you Google Manfred Ullmann, you will find his book related to this art. And then according to him, even though he's the Western scholars or what we call Orientalists, he lists down in his bio-bibliography several authors that interest and wrote about the medical medicine of the Prophet. And no doubt, finally, at the final stage of medical or the medicines, which has been contributed by Ibn al-Qayyim. Ibn al-Qayyim with the title Tibbu al-Nabawi. Tibbu al-Nabawi of Ibn al-Qayyim still very significant, because not just only to because you see the date Ibn al-Qayyim who died in 13550. That means around 750 years after the death of the Prophet, something like that. So mean the collection of hadith already settled, the interpretation of the hadith also very settled, but Ibn al-Qayyim add one more in order to integrate with Greco-Islamic medical theories, with the Greek civilization, in another word. Since Ibn al-Qayyim is a religious scholar, not just to expert in what we call the Tibbu al-Nabawi, he also expert in what we call Sufi, philosophy, as well as Al-Quran, Al-Hadith. That's why he wrote the book with the title Zadu al-Ma'an, I think with 7 volumes, very big. What is the importance of Ibn al-Qayyim? He tried to what we call interpret Islamic medicines with the integrations of Greek intellectual culture. Right? Of course, this is very beginning. And the Greek civilization or Greek medical literature will be elaborated more and more scientifically during what we call Umayyad period as well as during Abbasid period, by which we are going to see later. And after Ibn al-Qayyim also contributed by As-Sayuti in his At-Tib an-Nabawi also. As-Sayuti died in 1505 after Ibn al-Qayyim. He also influenced by Ibn al-Qayyim method of understanding At-Tib an-Nabawi, because we have to understand that At-Tib an-Nabawi, even though there is a simple advice or simple treatment and prevention and so on, but we have, do you think that it is as scientific as today? Of course, there is not scientific as today, because today to be called as scientific, you have to be proof, you have to bring the disease or what we call the drug to the factory, laboratory, and so on. However, during that time, we will say that it is a scientific because the treatment is was based on the origin of the disease, and the disease can be cured. So more than enough to be called as scientific, not just what we say that ilmu hitam, ilmu black knowledge, or what we call without using the rational explanation about that. Of course, later on, scientifically grow here and there because the complex of the society, the one that we create, the society become complex and more complex. So therefore, we need more drug in order to treat the disease. Like for example, we understand that the simple drug maybe today is called as paracetamol. If you go to any clinic or hospital, the doctor will give to you paracetamol because there is a simple drug. There is no maybe side effect. There is safe. Therefore, everybody can use that. Can what we call use as the way to treat the disease. And of course, today we have several kinds of paracetamol, but under the category of a simple. Right? So therefore, maybe later we come, okay, now we come to the next slide, the patronage of Abbasid Khalid. When we come to the Islamic medical traditions or management, no doubt, the contribution of Abbasid Khalid is a crucial one. Why? Because the Caliphate participate directly in the intellectual culture, as well as appreciate what has been contributed. Therefore, during this time, you will see several thousands, what we call Muslim scholars who are very, very expert in medical science, what we call, including what we call clinical science, and so on, right? With the support financially as well as morally by the Abbasid Khalid during golden period. And tolerate with the scholars, because during these times, not only the contributed by the Muslim, by the one who are the followers of the religion Islam, many also the Christians, many also Jews who wrote the book about the Islamic medicines. And during this time also, what we call the new institution called Baitul Al-Hikmah, the House of Wisdom was founded, was established at the center of the Abbasid capital Baghdad in about 800th century. So that is why Baitul Al-Hikmah become the center of the translations of the previous book. Almost we can say that Greek book, not only just philosophical book, including also medical science, has been translated by the Muslim scholars by means of Baitul Al-Hikmah, which has been founded by the Abbasid capital. And we know that what we call during Islamic civilizations, the way to manage the disease, the way to prevent and preserve the disease have to be one of the responsibility of Bimaristan. Bimaristan is a Persian word. Bimar means sakit, tan means house. What we call the house of the house of patients. So that is why we call in Malay rumah sakit. We do not say al-mustashfa. Al-mustashfa means hospitality. But actually in the past we call Bimaristan and then we translate it into Malay. Maybe I'm sure that influenced with this kind of the culture, rumah sakit, meaning that the hospital. Actually, hospital bukanlah kata rumah sakit in terms of the meaning. However, the Bimaristan has been established in all corners of Muslims nations or cities. But we have two kinds of Bimaristan. Number one, we call fixed Bimaristan, and number two, mobile Bimaristan. In order to manage prevention, preservation, as well as treatment of disease, therefore, the role of Bimaristan, including also as the center for caring, curing the sick, both soul as well as the body. Because in Islam, maybe a little bit different, the hospital or what we call Bimaristan is responsible for curing physical disease as well as moral disease. And at the same time, also Bimaristan as the center of the research teaching also, and so lastly, the center of academic and administrative organization. Yes, we understand that some university, including also, I'm sure, fakultas ilmu kesehatan, UIN Syarif Hidayatullah Jakarta, sure, dia establish its own hospital, and the hospital become maybe teaching hospital, research hospital, at the same time also to be the center for the treatment of the disease and good service to the community in Indonesia as well as to worldwide. So this is the role of Baitul Hikmah. I say to you that the House of Wisdom, the translations, that's why Hunay Ibn Ishaq become the director of the House of the Wisdom. And he wrote one of the epistle, informed to everybody, saying that Risalah Hunay Ibn Ishaq ila Ali Ibn Yahya fi zikru ma turjam min kutub Jalinus bi ilmihi wa ba'du ma lam yutarjam. That means that I just informed, list down to you what are among the book which has been translated by him of the book of Jalinus. Jalinus means Galens. Galen is the last Greek prominent scholars in medical science, but all this book has been translated almost, as well as the book written by Hippocrates, written by Dioscorides, written also by as well as Galen commentaries. So meaning that we reach with the intellectual medical knowledge during Islamic civilization. But the question is, who among our contemporary scholars dare to study that kind of the knowledge and try to harmony with modern medical knowledge in order to find the real, what we call, answer of the challenge that we are facing today. Now, we talk about the prevention of the disease, the first part. As I mentioned to you, even some Muslims, when they ask you, what do you mean by medicine? They will say that preventions, rather than what we call the treatment of the disease. And so in this regard, we find that it is harmony with the concept of Quranic and of Sunnah, as mentioned here. What we call, ask Allah SWT to grant you certitude as well as well-being. So not just to ask Allah SWT to become rich, rather than to be in good health. When you are in good health, you can find the knowledge. You can also, what we call, find everything, including also your partner and so on. But if you are not in good health, you will be nothing, in another word. That is why the Prophet repeatedly advised you to ask not only for others as well as for well-being. This another hadith saying that there are two gifts which has been given by God, and normally we were cheated, mean that we forget about the importance of that gift. The first one is health, and number two is leisure, free time. So try to think about that. I'm not going to explain in detail about these kinds of the concept related to the preventions, because I have so many slides to go through. Now, Al-Haris Ibn Khaldah. Haris Ibn Khaldah is the only well-known medical doctor during the time of the Prophet. He said that prevention is the essence of medicines. That is why I mentioned to you the essence of medicine is the what we call prevention, not the treatment. In another word, that is the Islamic point of view, right? Of course, does not mean that Islam do not give special consideration to the treatment of disease and so on. But if, for example, all of us or majority of us are healthy, I think so many problems can be solved. No need to have what we call COVID-19. No need to have H1N1. No need to have this disease, HIV, AIDS, and so on. And today maybe penyakit yang muncul disebabkan what we call the monkey and so on, right? And that is why the statement saying that dirham wiqayah khairun min qintaru al-ilaj, the guardian, the protecting, the preserving personal well-being was considered better than medical treatment. Medical treatment, even though you, for example, the government spends what we call qintaru al-ilaj, buying what we call the very high technology in order to laser, or maybe we say that X-ray equipment in order to know what we call to treat the disease. Yes, spend a lot of the money because we have the problem about the disease. We do not care what we call really about the prevention. Therefore, we spend a lot of money. Even though you spend a lot of money and less what we call budget for the prevention must be better than others. So this is okay. In order to have a preservation of health in Islamic medical tradition, this is what we call the 7 principle. Sometimes we call the what we call Sita or Sabah, something like that. Principle, this one, if we follow one by one this concept, for example, refine hygienic regulations and balance in all part of our body, of our thinking, moderate is the best, is maybe one of the way to prevent from any kind of the disease. Regulate the balance and moderate in habit of eating. So we have to create our habit of the eating, not too much, not too little, and moderate. And of course, if you have our lifestyle in terms of the eating in lines with the concept of 7 principles for the preservation of health, I'm sure that this is the idea. Rejection of excess in every circumstances and conditions, right? So no need, for example, if the food in your body excess, so not good, we try to avoid from that. If, for example, unfortunately, already excess in our body, we have to find the means how to burn it. Of course, by means of riyadh, by means of exercise. And number 4, living in healthy surrounds with the environment and so on, right? Maybe with the natural, with the tree, with fresh air and so on. So this is the thing. Avoiding of any excess before such bad habit become uncontrollable. And number 6, continuance of realizing the true harmony. And number 7, acquisitions of reticence, meaning that try to find out the very quiet harmony and tranquility conditions. For example, if you stay in the city, of course, sometimes not good because crowded with the people, with so many harmful things, like we say the carbon of cars. So therefore, sometimes we have to find a place which make you what we call peace, quality, tranquility. Maybe you have to go somewhere else and so on. All right, and then the next ones, according to Islamic traditions, when we say that food is the origin of disease, but this is the idea of Ikhwan as-Safa. Ikhwan as-Safa is one group of the Sufis, which has been what we call established in long time ago, because sometimes Sufi try to treat the disease also not similar as we treat the disease today. Like for example, we found that the founder of India, right? We say that the founder of India, he's because I become the leader, and then finally he tried to avoid the treatment of disease by using some drug rather than using the natural items. So because he also concerns about the spiritual aspect or moral as well as the heart aspect of the body. So in this case, Ikhwan as-Safa, when he looked When they look to the food, they say the food not only affect to physical aspect, to its physical, as well as to the moral, to the ethics of human being, as well as to the character of human being. So be careful about what has been consumed in another word. So therefore, Ibn Khaldun in this case, among the heroes who is not the medical doctor, but in his Muqaddimah, he tried to explain rationally, and then he found, based on his maybe quantitative research or qualitative research maybe, he said that people whose food are simple have less ailment than those that eat in greater quantities. In another word, if your food is more complicated, so maybe, no doubt, we have to prepare the center of the treatment in this case. Rather than if, for example, your food is simple, like for example, if you eat, for example, oats, for example, very simple, or maybe vegetable is very simple, not to become vegetarian as it is, maybe at the same time, we have to make sure that something which indicates that simple in our body. So therefore, according to Ibn Khaldun, less what we call people who face the problem of the disease in this case. Eating and ibadah in Islam, prevention also, we eat not just to eat, we as the servant of Allah SWT, in order to survive, in order to make sure that we can perform ibadah well, so therefore your eating can be converted into ibadah, will be rewarded by Allah SWT. There is a difference between us and a non-Muslim. Stop eating while there is a little appetite. This is the practice or tradition or lifestyle in the past. So if you must eat more, be sure that only 1/3 of your stomach is filled with the food, 1/3 is left for the water, and the remaining of third for the air. So in our body, we have three elements. However, in Greek civilization, they understood that four elements instead of 3. But according to the hadith, water, and then food, water, and then air. The Greeks say that no, we have also fire in our body, right? Maybe the heat, right? But Ibn al-Qayyim, because he is a traditionalist scholar, he tried to respond to the Greek, not 4 rather than 3. Right? But however, if you want to say 4 or 3, sometimes maybe also not too different, right? Not too different, but based on your interpretation only. Avoid prohibited food. This is also the way for the prevention and preservation. And also prohibited foods are allowed to be consumed when pressed by necessity. This is in Islamic way. In the case of darura, we have to consume even though prohibited items to make sure that we can maintain and survive better and better. And honey and milk as healthful drinks. No doubt, I'm sure everybody know about the honey, about the asal, mentions in the Holy Quran as well as in the Hadith. And milk also considered as helpful drink, but significantly, we have very special chapter in the Hadith about at-talbina. Right, I will mention to you. Before that, cleanliness, no doubt. Therefore, in the Sahih Bukhari as well as in others, they are very concerned about cleanliness. When we talk about cleanliness, that is about the wudu, about al-ghuslu, the book of bathing, the book of haidu, the book of tayammum, all these things related to cleanliness, we indicate that we have to keep it clean. Even, for example, today, one of the recommended by the COVID-19 scholar, they say that if we keep clean as much as possible, maybe the spreading of the coronavirus will be less compared if we ignore about the importance of cleanliness. So meaning that this concept has been practiced before. However, sometimes our lifestyle may be complicated, sometimes to practice here and there also very difficult, because sometimes we do not see whether we are clean or not because of virus, because of that we cannot see physically, right? Okay, siwak, I think it's a prevention measure for the teeth, right? I hope you understand, you know about siwak, even though very simple. Laulam asyuka ala ummati la amartuhum bi as-siwak. But when we find about the contents of a siwak, we found that many things can kill what we call the virus, right? Meaning that the item that we use for a siwak are able to kill the bacteria and so on, right? Because the siwak carry something which able to kill that kinds of the bacteria. That is why the importance of siwak is clear, right? So this is less cost. So you want to practice, even today we may practice, right? No doubt. And then there is the opinion of the Ibn Al-Qayyim in regard to siwak, and just go according to him, for example, to refresh your mouth also strengthens the gum, stop flames, make the signs clear, prevents cavities, make the stomach healthy, purify the voice, and so on. Sometimes when we say that, how to prove that? By siwak, to make the signs clear and clearer. Because of course, sometimes our eyes, I just experience by myself. If you look every day to the sea or the ocean, if you look every day to the tree, for example, you will compare after 5 years or 10 years, your eyes must be a difference, become more clear and clearer, something like that. So by using siwak, we have to test by using not only 1 or 2 times, we have to use maybe 5 years, 10 years, and then you will look what we call the difference. Tayyibat food as a preventive measure, since Allah SWT asks you to consume kulu mimma fil ardi halalan tayyiban. I'm sure the halal tayyiban, if you become your lifestyle, try to avoid the prohibited item which mentioned clearly in Quran, for example, al-maitah and its derivative, as well as waddamu, the blood, and the flesh of the swine, as well as what we call slaughtering without mentioning the name of God, or in another word, does not slaughter according to the Sharia. This is 4 items that we have to avoid. So the opposite of the tayyibat. So make sure we understand that tayyibat food must be good, because under the category of what we call the halal and tayyiban, and then under the category of nikmat of the bounties of Allah Subhanahu wa Taala. And no doubt, preventions of drinking al-khamar also as a preventive measure, because the khamar will be affect not only just your body as well as your soul. And promotion of prohibition to commit the suicide. That's why, alhamdulillah, among the Muslim community, we found less and less the Muslim commit suicide, even during what we call COVID-19. Of course, we have very few numbers the Muslim commit the suicide, but because of the Sharia, saying that very clear, if you commit suicide or what qatla an-nas, you will be resided in the hell. So therefore, less among the Muslim. So this law very effective, right? And now you say that do not use compound drug as long as the simple drug is useful. So of course, maybe I'm sure there are medical doctors here, they know about the simple drug. Maybe among this simple drug, I'm sure paracetamol under simple drug, and maybe the drug which is based on the diet or based on food, based on natural sources, will be regarded as a simple. If you can use that kind of the item as the drug, which under the category of simple, and so no need to use the simple the compound drug, which is chemical and complicated one, unless that is necessary. For example, if for example for you to operate is must be the last choice in the Islamic tradition. Number 1, you have to use simple drug. Number 2, compound drug. Number 3, of course, you operate. Right? Not to start with the operate first, because that is why we found that the Islamic traditions in regard to the surgeons or operates the body, what we call emerge at the last stage of Islamic civilization, especially by Az-Zahrawi. Az-Zahrawi, the one who wrote the book At-Tasrif about the tool being used for the operate the body, but that one also emerged at the last, because during the first two stage of Islamic civilization, seemed that no need to use that kinds of the method for the treatment, right? So because their life also very simple, but today our life is more complicated. That is why sometimes the doctor keep to use what we call the operate, especially for the delivery, right? As the first choice, right? Okay, the khitan, circumcisions, I study about this, right? Especially about among the male, And Alhamdulillah, most of the Muslim, what we call perform this. And we have to understand that we perform this, we follow the tradition of Nabi Ibrahim, the first prophet who performed Al-Khitam. Right? And then after that, we perform until today. Of course, no doubt, we found that even non-Muslim also, some of them try to follow this kind of practice, because prevention's better than cure. So maybe, and of course, maybe there is another reason behind. There is also another reason behind the importance of the wisdom of khitan, but I'm sure that is in line to what we call what has been practiced before, because in the time of the Prophet as well as before, saying that this is considered as fitrah. Fitrah meaning that the thing that we do in according to our nature. They already define like that. Prevention from contagious disease, maybe chronic disease and so on. Contagious disease including also what we call the COVID-19 that we have today. And of course, we do not have COVID-19 before. We have the disease called as a ta'un. A ta'un means what we call the contagious disease. We translate as a contagious disease. Even in the time of Sayyidina Umar al-Khattab, there was the companions called Abu Ubaidah, the one who died because of ta'un, because he was sent to go to the Syria. Syria today, during that time, maybe we call as Asham, to open the city, and finally there is disease broken there, what we call ta'un. But Abu Ubaidah, his belief that no, since we already have the intention, everything has been determined by God. You want to survive life or death in the hand of God. He continued, even though the Sayyidina Umar saying that we have to withdraw from our journey to the Syria because of this contagious disease. But some of the companions still insist to go and continue the journey, and finally they die. That is why what we call prevention in another word, or what we call quarantine in our context today. So meaning that if you withdraw from to continue your journey to go to the place that broken the disease, contagious disease, the disease can be spread from one person to another person. Like for example COVID-19 today, and in the past maybe what we call the hadis tentang yang berkaitan dengan smallpox, and as well as what we call the another disease, the disease of lion. Maybe we can say after this, but the idea of prevention this kind of disease has been through very clearly and been elaborated by the Muslim scholars. Just to be considered as a preventive measure. This is al-juzam, right? Because why? Precautions against al-juzam. Juzam is one of the disease known as leprosy today. And in the hadith that mentioned in Bukhari, very clear, saying that leprosy or al-juzam, in Arabic medical literature, the disease is known as the lion disease. Why the lion disease? Because the face of the patients like as the lions. And the disease has its extremes, but we still do not find any single hadith giving a clear method of treatment of the leprosy during that time. But the disease has been emerged. However, in simple, these strong commands or advices an effective method of prevention, the spreading of the leprosy from the one to another. It was believed that because why the Prophet said that you have to avoid from leprosy or al-juzam as you escape from the lion. That is why this disease was known as the lion disease. So of course, today, if we look to the lions, if we go to the forest and find the lion, we have to escape or maybe avoid from lion as fast as possible. As for example, in the past, they say in the hadith, you have to avoid this as you avoid from the lion. So meaning that we cannot approach and they come close with the patients of this disease, right? This is leprosy. And another one that is about azuba or the fly. The Prophet also mentioned, and today scientifically they already study about what we call the fly. But the tradition say that if a fly fall into the vessel of any one of you, let him dip the whole of it into the vessel and then throw it away for on one of its wing there is a disease, and on the another is the healing. That is why we say that antibody, the concept of antibody, that is why no doubt, I'm sure the vaccine that we have today, and no doubt maybe the drug, if we believe that in the future there is the medicines for the COVID-19 in the future, maybe you can use this kind of the concept, meaning that one of the object or one of the things, let we say that coronavirus, maybe at the same time there is also the healing part of the coronavirus, meaning that maybe, for example, in terms of life, according to hadith, one wings carry the disease, another wing carry what we call the healing, or what we call antibody. So in this case, in order to be neutral in your food, in your whistle, in your drinks, you have to dip it. So that concept maybe can apply to propose or to generate or to innovate what we call vaccine, meaning that you use its own what we call essence, you use its own what we call things, or what we call virus, in order to protect another virus emerge, or maybe if you are strong enough, you can kill that kind of virus. This is the concept. And of course, I'm not the one who produce the drug. I'm not the factory like Pfizer, like company and so on. But we need also research and regarding about this. This is very simple, what we call concept, but we have to think about that. But maybe the China, maybe they use the virus which already died, for example. But some of the vaccine or the drug maybe use the coronavirus which still alive. So this is maybe two opinion how to do that with the technology. I hope that the scientists as well as medical doctor are able to do that, right? And the most important part also in the Islamic tradition, consider. Sorry?
My apologies, I interrupt
Sorry?
you. I have been noticed by the committee that the presentation time is remaining 10 minutes. Thank you.
How many minutes more?
5 minutes.
5 minutes? Okay.
Yeah.
So no doubt, give me 10 minutes. Sorry, give me 10 minutes. Prevention of mara al-qalbu, the disease of the heart. This is the most important one in Islamic traditions, right? Because when we say the heart here, not the physical heart, the heart something else related to psyche, or what we call related to moral, ethic, and so on. So because accordingly, if your heart is in good conditions, your physical also in good condition. Okay, now we come to the third part, which is the last one, healing or treatment of disease, right? Maybe I just to follow what has been said in the hadith first. There is the chapter called healing in three parts, right? Chapter say that Ashifa ala salasa, there is three, the healing must be based on three things. And no doubt, when we say the hadith say that what has been there is no disease except Allah subhanahu wa ta'ala will create what we call the cure. The problem, how to find the cure, there is another problem. But when we come to the tradition, say that healing is in three things. So very simple one, this is in the hadith. Number one is healing is in three things, a cup of honey, you use honey. Number two, cupping, and number three is branding with the fire. Three only. However, I forbid my followers to use branding, to use branding with the fire or cauterization. So meaning that nowadays we have so many methods, but I think another method, for example, you use laser for the treatment or maybe for the surgery. This is under the category of what we call branding with the fire, or what we call the cauterizing by using the fire. And of course, when the hadith said the forbid, there is the interpretation behind that, because during that time they understood that the fire is they worship the fire during that time according to the agama Majusi. But during that time, the people understood that fire can cure the disease rather than God. Therefore, the Prophet say this kind of manner. Actually, if for example you say that Ashifa min Allah, and then you use the fire as the main laser or maybe X-ray, there is no problem in line with this hadith. Maybe you say that the drug that we have, the drug maybe under the category of what we call the honey here, or maybe under the category of cupping. Cupping, you just take out the blood, right? You try your best in order to take the virus, the bacteria outside your body. So maybe we can call cupping or maybe another method. That is fine. But in general, this is what we call the principle which has been highlighted. Right? So the importance of honey, no need to mention because of time. Cupping al-hijama in Arabic, the hadith mentioned clearly. And al-kayu, branding with the fire, cauterizations. So very, very important now because everything sometimes the treatment using the fire, even for example, your drug, there is the temperature of the drug, maybe what we call the compound drug in terms of the heat also maybe higher than that. So this is also the concept of cauterization or what we call branding with the fire, using the fire in the treatment, because we know that the temperature of the drug and so on. That is the and the medical benefit of Habatus Sauda, which black seed popular use during the time of the Prophet as well as others. But sometimes we are not able to answer why the Prophet said that there is healing in black seed for all disease except death. So we say that, can we use, for example, black seed for the COVID-19? That is the question. That one I'm not able to answer now. But this is maybe one of the, I don't know how to interpret that, but no doubt there is no harmful to take what we call the black seed, even for the COVID-19 patient and so on, and even for others. Talbina here, talbina something related to what we call the meal. We say that treatments, but say that talbina using to treat, we specifically for the treatment against the sorrow. If you are sad, if for example you are not happy, because why, during that time the people, when they consume or drink the milk, they become full and very happy. Because why, like for example, like Indian people, they drink the if there is no milk for them, maybe they are sorrow. If for example there is milk for them, they are very happy. So because the milk made them full in the stomach, not hungry anymore. So meaning that talbina as a treatment of sorrow in that aspect. And they treat disease with the urine or the camel. This is also very controversial one, but the hadith is very clear. And even Imam Bukhari mentioned as one chapter, Ad-Dawa bi Abwal al-Ibil. I wrote one article and you can Google about that. However, the hadith clearly mentioned there is a benefit behind the what we call drinking, so what we call the urine of the camel, but not for all, for a particular person who are suitable to use that. However, there is another controversial and another interpretations as far as this hadith is concerned. I'm not able to change the text of hadith. I just to say here, that is the practice in the time of the Prophet. Maybe that time suitable, but maybe our time is not suitable to use this kind of the thing. Therefore, in India, you see, during COVID-19, they try to drink the urine of the cow, something like that. This is their belief, right? Ruqyah, no doubt, incantation today. Now we have very complicated society. So because of this belief and so on, no doubt, the prayer, mu'awizah, zikr must be as important means. Right? Okay, now we come to the theories. Give me 5 minutes about this, because this is also very important, because highlight to you about the theories and finding from the prominent figures in medical health, starting with Abu Yusuf Al-Kindi. You see, fi ma'rifatu quwwa al-adwiyah al-murakkabah, the knowledge of the density and quality of the compound drug. You want to, the theory saying that if you had the drug, they try to find what we call the density and the quality of the drug, of the compound drug, whether the heat higher or low. So, and then if you found that you have a problem with the temperature and so on, maybe you have to use the proper drug. But this theory has been established by the Al-Kindi long time ago with the title of the book, The Knowledge of Density and the Quality of the Compound Drug. At the same time also, he wrote the book, Fi Al-Hilah Li Dafu Al-Hazan, the way how to relieve suffering and sorrow. Very scientific one, so simple one, in order to avoid from the sorrow and suffering. He advised us not to come close with something that you are not able to get. That one. So this is Al-Masail fi At-Tib. That means the 100 questions in regarding about the medicine, he tried to answer clearly based on based on his understanding of Hippocrates' idea, Dioscorides' idea, and Galen's idea. So this is by Hunayn ibn Ishaq, known with the books, what we call the Al-Masa'il fi at-Tib, the question that related to the medicines. So this is a little bit. So now we come to Abu Hanifa ad-Dinawari. Ad-Dinawari, among the very few Muslim scholars who try to understand an-nabat, and using an-nabat as as what we call the drug, and finally treatment of the disease, scientifically, of course. And he lists down one by one as a dictionary, and then the patient, physician or medical doctor can benefit from this book in order to treat the disease. And according to him, he classified the plant also in very good manner. For example, plants which may be used for food as a diet. Secondly, the wine plants, and thirdly, plant with nutritive fruit and so on. So this is Ar-Ruhawi, Medical Ethic, Kitab Adab al-Tabib. I the one who translate this book into Malay, but the first 3 chapters already published. The rest are not yet published. I hope what we call UN also interest to publish my translations of Adab al-Tabib. He wrote long time ago, but for me it's very comprehensive in order to understand the medical ethic. When we say the medical ethic, not just to talk about the manner here and there, but also to talk about something which is very complicated, related to prevention, related to treatment of disease, related to preservation of health, under the umbrella of medical ethic. So this is the only book which is very interesting one. So I know this because I translate together with my colleague, my former staff from Indonesia. And then the book by Ibn al-Qurra, of course, the classification of knowledge. They try to put what we call medicines under natural science, or maybe under what we call religious knowledge and so on. So therefore, and then in this, he also, in this book also, he's able to find out the medicine in regard to the therapy of something, especially smallpox and measles, which are considered as among the very dangerous disease during that time. But maybe not today. Today we still have what we call the disease related to joint or gout. Maybe they have the treatment during that time, but today we have another method of the treatments. But for me personally, because I was attacked more than twice, what we call by gout, and finally I managed to do that, not by using any drug, but using my own practice and treatment based on the natural practice. Right, this is my experience. And then Abu Hassan Ahmad At-Tabari with the book Al-Bukhratiyah, as I mentioned to you before. So therefore here he also tried to give the definition, because we have to understand, when we study about medical art, we have to remember about Al-Bukhratiyah, Hippocrates. Hippocrates among the founder of medical science. Before that, we have Asclepius. That is why we use the logo of WHO with the stick, tungkat Tungkat, that one tungkat ataupun stick of the Asclepius actually, macam dalam bentuk ular, dalam logo WHO. And then we have Abu Al-Masihi Al-Jurjani, fi al-mi'ah fi atib, also the same thing. We many finding here, I'm not able to and no doubt, when we talk about Islamic medicine, we come with the theory and the finding from Ibn Sina. That's why Ibn Sina known as chief master with the book that he wrote about Al-Qanun fi at-Tib, Qanun of medicine, to the extent that he tried to give the law of the medicine. Not so easy, because normally we know just in the level of theory or opinion or observation. But in this case, Al-Qanun already, he put the title Al-Qanun must have special significance. He used also Al-Adwiyah Al-Qalbiyah. Al-Adwiyah mean drug, something like that. And then Al-Manazir, this is the book related to the optics by Ibn al-Haysam, which is very significant. I'm sure that the optician that we have today must be indebted to this kind of the finding. Otherwise, we are not able to produce the glass that we have today and the color that we see today, elaborate in very beautiful manner. In this case, the optic which has been contributed by Ibn al-Haysam, who died in 1039, must be very, very interesting finding in regarding about this. Of course, today we develop the theory of optic according to our time. Right? And no doubt the Abu Bakr ibn Zakaria al-Razi, the ones who was known and named by the Sultan in his book, the introduction to the history of science by the time of al-Razi. The time of al-Razi around 100 years, so called as at the time of al-Razi because he really mastered about medicine as well as philosophy during that time. With the book, for example, Al-Hawi, the book Al-Hawi. And I list down to you in my slide here, several books. So if you can go to another slide. This is Al-Razi, the book. The book of medicines, around 56 books. The book on the nature of science, you see from the book 57 until 89 and so on. So the total around 184 books has been written by Abu Bakr Zakaria Al-Razi with several findings and also conclusions. Very interesting, very interesting. Not just one, but so many. And Alhamdulillah, more than so many of his books still available in our library today. And no doubt the final one is Al-Biruni. Al-Biruni, the one who wrote the book As-Saydana fi At-Tib. As-Saydana means pharmacy, pharmacology, and medical science, according to Islam. He's a little bit different with the previous scholars. Previous scholars tried to engage with the Greek civilization, but he's the one engaged with the Indian culture, Indian civilizations. That is why he know a lot about the plants, about the mineral, which has been found in the subcontinent as well as in Asia. So with the As-Saydana fi At-Tib, I translate to you pharmacy, pharmacology, and materia medica by Abu Ar-Rayhan Muhammad Ibn Ahmad Al-Biruni. So this is the last maybe contribution for Rasulullah, and allow me to give the conclusions. Conclusion as far as preservation, prevention, and treatment of disease in Islamic medicine tradition is concerned. Number one, when we pondering the method of treatment of disease, one finds that the treatment of disease in the time of the Prophet was basically according to the nature of disease. And to know its treatment, they were advised to know its cause and symptoms. Ma'rifatuhu bitahqiq as-sabab wa al-alama. This is the wording that I found in the book. Number two, we should not use At-Tibun Nabawi, medicine of the Prophet, without empirical research because of the change in the medical plants, environment, as well as the meaning of living linguistic term, maybe today. Because the term has been produced maybe 1,400 years ago, maybe not the same as we understood. Number three, it is found that the dietary habit and food play an important role in disease and healthy person alike. A well-balanced and correct diet is essential for a maintenance of good health of a person, and so on. Number four, lastly, it is obvious that traditional preventions, treatments, and protection of disease in Islamic medical traditions come in several forms. It is not just physical by using drug, but also in the form of ruqyah, incantations, with the verses of the Holy Quran as well as with the dua. Thank you very much for your time, for your listenings. I'm very welcome to the questions and answer. Wassalamualaikum warahmatullahi ta'ala wabarakatuh.
All right, thank you for the great presentation from Professor Nurdeng. And it's already mentioned all of the important topics or important issues in the presentation, and I don't want to repeat the important topics again. And I move to the question and answer session. And here are some questions that already asked from the participants in the Zoom meeting chat room. The first one is, I think if other participants that want to ask question by raising hand, you can already raise a hand, but there is already some question in the chatting room. So the first question is, thank you for the interesting topic. Some people thought Tib Nabawi works for prevention only and not for current disease. Therefore, Tib Nabawi is considered as complementary therapy. What do you think about this, and how the practice of Tib Nabawi in your country? Thank you for the answer. So please, for the...
Sorry, I'm not clear. Can you repeat again because your voice is not clear here? Sorry, please repeat again.
I'm sorry. So, some people think that the Tib Nabawi only works for the prevention only and not for the curing the disease. And what do you think about that statement? and also how the practice of
Okay.
Tib Nabawi in the Brunei Darussalam.
Okay, okay, thank you very much. Number one, of course, since Tib Nabawi come from the Prophet, if you try to deny the importance of Tib Nabawi, meaning that you want to deny the importance of Hadith, the importance of Sunnah. Of course, the Tib Nabawi mostly the Sunnah based on what we call the Sunnah that related to medicines. If you, as I mentioned to you, we have to understand the Prophet tried to give you the concept principle of something. You can reinterpret. It's the room for interpretations. Reinterpretations will be open from time to time. From time to time, as I mentioned to you, some advice of the Prophet, or maybe according to the Hadith, like for example, we say that what we call al-ma'idatu baitu adab, right? Does not mean that the stomach as it is. The mean the food. The food here maybe in the time of the Prophet is not the same as in the time of our time, right? But the concept still relevant. Still relevant, right? Of course, this is maybe we can say that in academic explanation. But now we will look to the practical aspect that we have today. The scope of At-Tibbun Nabawi just very simple, right? Maybe cupping, something like that, with dengan lintah dia, and then maybe what we call the massage and so on, right? But of course, this is the form, and then including also what we call what we call incantations, or what we call dengan ruqyah sana dan sini. Of course, this is part of At-Tibbun Nabawi also. But I'm sure since the Prophet is the messenger of Allah SWT, his idea is not what we call very narrow. His idea must be what we call the universal, by which can be practiced at all age, right? That one is simple practice. You can do that if, for example, that practice suitable to you. But if not, maybe we have to accept that we have to find out another alternative. Maybe according to the modern prevention, treatment of disease, and so on. But do not ignore about the importance of that principle in order to find the solutions, right? Of course, when you ask me about the practice of At-Tibbun Nabawi in Brunei Darussalam, I can say that number one, of course, the aspect of what we call the incantations, or what we call the very popular here, dengan baca-baca ayat Al-Quran, as well as what we call baca-baca zikir, as well as dengan ayat-ayat al-mu'awwizat untuk menjauhi daripada syaitan dan sebagainya. This is very common and practice. The same time also cupping, ada lah center of cupping in Brunei Darussalam here and there. But when we come to the concept of the cauterization, tak ada yang tu. Right? Tak ada yang tu. Cauterization meaning that guna fire. Tapi kalau traditional way, macam kita kata dulu dilahirkan, apabila bersalin kita guna batu panas untuk keringkan darah, itu dalam bentuk cauterization juga. Yang tu dah kurang dah, sebab modern medicines widely spread in all corner of negara Brunei Darussalam, and then they found that this practice is more relevant to them, even though it become more complicated, and therefore because of that, so many patients in the hospital. Okay, very short answer to you.
Right, thank you for the answer, Professor Nurdeng. And I think the time is already up, and unfortunately we have to end this session. And before we end this session, in the name of the Faculty of Health Sciences, I would like to give the online certificate to you, Professor Nurdeng. The online certificate. What's the online certificate? Here's the online certificate to you, Professor Nurdeng. Again, Thank you for your great presentation, comprehensive presentation, complete
Thank you very
presentation
much.
from you. And hopefully we will meet again in the next conference or next meeting with you. And I think it's the end of the session of this plenary session today, and we will move to the next session. Is the oral presentation session. And thank you for all. It's over to you, moderator. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you to Mr. Iqbal for being a moderator in this plenary session. And now, we would like to give a certificate to Mr. Iqbal as a moderator in this second plenary session. Here it is, the certificate to Mr. Iqbal. Please accept it, sir, for being the moderator for this session.
We would like once again to thank all the speakers, moderators, and participants for your attention and for participating in today's plenary session. We hope all the knowledge and discussion will be useful in the fields of health. Ladies and gentlemen, we would like to inform you that the next session will be the concurrent session that will be divided into 3 rooms, focusing on public health, pharmacy, and nursing.
For the offline participants, please come to room 1 for pharmacy, room 2 for public health, and room 3 for nursing. And for the online participant, please click on the links for each room in the chat boxes.
And please remember that we still have another session for tomorrow. Thank you for today.
And I'm sorry, and before we go, we would like to apologize for the inconvenience, especially for the extended time.
And please remember that we still have another session for tomorrow. Thank you for today. Please enjoy the session and see you tomorrow. Wassalamualaikum warahmatullahi wabarakatuh.
Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta merupakan hasil transformasi dari Fakultas Kedokteran dan Ilmu Kesehatan yang tujuannya bukan hanya menjawab kebutuhan zaman, tapi juga langkah strategis mempersiapkan tenaga kesehatan yang handal dan profesional. Fakultas Ilmu Kesehatan resmi berdiri setelah terbitnya Peraturan Menteri Agama RI Nomor 1 Tahun 2018 tanggal 15 Januari 2018 tentang perubahan statuta UIN Syarif Hidayatullah Jakarta dan diimplementasikan oleh Rektor melalui SK Nomor 141A Tahun 2018. Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta mempunyai keunggulan dalam mengintegrasikan ilmu kesehatan dan keislaman. Progresivitas tersebut tidak terlepas dari kemajuan teknologi yang secara alami merubah cara pandang dan pola hidup di masyarakat. Oleh karena itu, hadirnya FoHS UIN Jakarta diharapkan dapat memperkuat pembangunan kesehatan yang berwawasan keislaman. Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta memiliki 5 program studi, 3 program studi tingkat sarjana, dan 2 program studi profesi. Kelima program studi tersebut sudah diakreditasi oleh LAMPTKes sehingga membuat Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta sejajar dengan universitas besar lainnya di Indonesia. 5 program studi di Fakultas Ilmu Kesehatan UIN Syarif Hidayatullah Jakarta adalah Program Studi Farmasi. Program studi farmasi mengaplikasikan nilai-nilai keislaman dalam pengembangan ilmu kefarmasian dalam rangka membuat dan menghasilkan produk kefarmasian yang bermanfaat untuk masyarakat dengan memperhatikan status kehalalan dan ketoyiban. Peluang karir lulusan prodi farmasi antara lain tenaga ahli farmasi di rumah sakit, lembaga pemerintah, industri obat, kosmetik, alat kesehatan, apotek, wira swasta, distribusi obat, peneliti, tenaga pendidik atau dosen, dan tenaga ahli kehalalan obat. Program studi kesehatan masyarakat. Program studi kesehatan masyarakat mengkombinasikan dan mengedepankan nilai-nilai keislaman dan kesehatan yang ada dan berkembang di masyarakat. Lulusan prodi kesehatan masyarakat yang berintegritas dapat berkarir di pemerintah, perusahaan, rumah sakit, tenaga pendidik, klinik, dan tenaga kesehatan lainnya. Program studi keperawatan dan program studi profesi nurse. Sebagai salah satu program studi dengan akreditasi A, program studi keperawatan dan profesi nurse menyelenggarakan pendidikan yang terintegrasi antara nilai-nilai keislaman dan keperawatan sehingga menghasilkan lulusan yang kompetitif, berkualitas, dan religius. Lulusan program studi keperawatan dan profesi nurse berpeluang besar untuk menjadi nursing trainer, perawat profesional, peneliti, dosen, dan entrepreneur di bidang keperawatan dan kesehatan. Program studi profesi apoteker. Program studi profesi apoteker menghasilkan lulusan unggul.
Udah masuk belum, Pak? Udah masuk? Situ. Iya, arah yang gitu tuh, yang arah panggung, yang presentasi sana tuh.
Tapi ini nggak masuk itu, Pak?
Enggak kayaknya. Pak Iqbal, yang presentasi offline di situ atau